Hello, everyone. Welcome to the Ventura County Board of Supervisors for March 31st, 2020. This is our special meeting, so thank you for everyone to attend. We have several Board of Supervisors that are remotely accessing this meeting. So let's have a roll call, please.
Supervisor Zaragoza?
Here.
Supervisor Bennett?
Supervisor Bennett? I see him.
Here.
Supervisor Parks?
Here.
Supervisor Huber?
Here.
Supervisor Long?
Here. Thank you very much. So we have everybody. Next is the Pledge of Allegiance. Mr. Berg, would you like to lead us?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. I heard today on the radio they did the Pledge of Allegiance, and so many of the kids are out of school, and that's how they start their day. So I thought that was very nice. Thank you. Mr. Powers, we have our agenda review.
Thank you, Chair Long, board members. Item number 9, CEO's Office, public hearing regarding adoption of an urgency ordinance temporarily prohibiting or suspending evictions in the unincorporated area of Ventura County. A board letter and Exhibit 1 have been submitted. Item 10, CEO's Office, ratification of the County Executive Office's execution of grant agreements to the Ventura County Continuum of Care and the County of Ventura in COVID-19 emergency funds. A board letter and Exhibits 1 and 2 have been submitted. Item 11, CEO's Office, authorization for the County Executive Officer to waive board policy prohibiting certain contract provisions. A board letter has been submitted. And finally, item 13, Healthcare Agency, authorization for the Healthcare Agency Director to waive sliding fee discount payment program and self-pay discount program patient costs for office visits due to respiratory or COVID-19 related symptoms. A comment letter from MyCop has been submitted. And that's it. Thank you.
Thank you very much. Supervisors, do you have any other modifications, changes? I do not. In saying so, can I get a motion to approve the agenda?
Huber, so moved.
Huber is a first, and can I get a second, please? Second by Bennett. It's been first and second. We're now going to do a roll call for votes. So Lori, if you could lead us on that, that would be great.
Supervisor Bennett?
Yes.
Supervisor Parks?
Yes.
Supervisor Huber?
Yes.
Supervisor Zaragoza?
Yes.
Supervisor Long?
Yes. Motion has been approved unanimously. Thank you very much. Moving on to public comments. I believe we have one. Lori, if you could read that for us, please.
We have one public comment that came in last evening from Monica Gray. She says, "Dear board members, need PPE for frontline workers, ? I was sent this information and wanted to share it with you. I hope this is what you're looking for and that we can all work together to crush this virus." And there was a PowerPoint included that I will be putting online for viewing this evening.
Thank you very much. So there's only one comment. Is there any others? No? Okay. That ends our public comment time. We'll now move on to board comments. Supervisor Bennett or Supervisor Zaragoza, would you like to go first?
Yeah.
Thank you.
Yes, and thank you so much, Madam Chair. I'd just like again to commend all the frontline providers that are helping us out. You know, Mike and Ashley, our firefighters, our sheriff department, especially our doctors and our nurses. You know, that are up front. You know, helping us with this horrible virus. I just want to thank them for that, and also I want to thank Mike Barber and Mary Ann Rooney over in Nyland Acres that continue to provide lunches for the children out there. They're up to about 1,600 lunches. And believe it or not, they also are doing census work. And also the lunches are being provided by the real school district. And also they're providing elementary lessons, computer-wise and also paper-wise. And again, I want to thank everybody for all their work. I know that time, and consequently, I think it's important that we do so. I also want to thank Maria Espinosa. She's from GSA. She left me a really nice note here in my office saying that she cleaned my workspace last night, sanitized it, and cleaned all of available hard sections and flat surfaces and counters and desktops. I just want to thank Maria from GSA for doing an excellent job for all of us. Thank you so much. And also I have an adjournment of some folks. Unfortunately, the list is someplace in the other desk, but I'll get that to the clerk's office. Thank you so much.
Thank you very much, Supervisor Zaragoza. Supervisor Bennett.
Yes, thank you. I only have one board comment, and it is on a PowerPoint slide. Could that PowerPoint slide please be put up?
And yes, we will work on that right now. Okay, it is up.
Can it be projected onto the screen so that the audience can see it?
Yes, it is. It starts with Ann.
Oh, it's not on my screen. I see just a picture of the boardroom.
Oh, okay. Hold on. We'll see if we can do it.
There
Do
it
you see
is.
it now?
Okay, now I see it. Good.
Great.
Yeah, my simple point is sheltering in place is the most essential thing for us to do. And while it is a challenge, I'd like us to remember we should compare it to this challenge that Anne Frank and 7 others hid in a 450 square foot attic for 761 days. We live in relatively nice accommodations by comparison to that, and we can certainly stay safe at home for the duration of this crisis. And so my plea is for everybody. Our frontline healthcare workers are literally putting their lives at risk dealing with contagious COVID patients. We can certainly do this and stay safe at home. So please, folks, stay at home. That's where we need to be if we want to save lives and honor the risk that the frontline providers are taking every day when they work with contagious patients. Thank you very much.
Thank you very much, Supervisor Bennett. Supervisor Huber.
Yes, thank you. I want everyone to know we are all in this together. We are strong in Ventura County, and we're certainly strong enough to get through these extraordinary times. To our county community, keep up the fantastic work out there. And to everyone, stay safe at home. Thank you.
Thank you very much, Supervisor Huber. Supervisor Parks.
Thank you. I just want to point out that I know that what the public sees here at the Board of Supervisors is just a small fraction of what we're all doing. The number of committees and commissions that we are on are all demanding a lot of our attention also. But our whole emphasis is to ensure the safety of our public and to do what we can to face what is going to be just a crushing economic impact as a result of this virus. So I wish all our constituents and all of the businesses out there our very best, and to let them know we are doing all we can to try to blunt the impact. Thank you.
Thank you very much, Supervisor Parks. Thank you very much for everyone who has tuned in today for our Board of Supervisors meeting. We've had a lot of people contacting us wondering why we don't have press releases every day, press conferences every day like LA County and so forth. And I wanted to confirm with everybody how important it is that you attend these Tuesday meetings so we can get a lot of information to our public. And then also that we are putting out so much information from crucial people, our doctors, our first responders, our critical workers, to make sure that everyone has the right information out there. I think it's really important that we're looking out daily. We are on radio, we are on newspapers, we're on social media, we have daily reports out. So the information is really getting out there. And I just want to say thank you to so many that are putting so much effort to make sure that our community is safe with the COVID-19. Thank you to Food Share with the National Guard coming to help and serve our family. Our farmers markets, thank you for the volunteers that are showing up, because most of the volunteers used to be over 65 and we're having to fill in volunteering spots. Thank you to the hospital foundation, all the people that are coming together to sew masks and donate gloves and so forth. Our senior food, the pantries that are being put together are just amazing. Along with that, our businesses with EDC moving as quickly as they can to get small business loans out and unemployment information out to their workers. And then also our Ventura County Community Foundation that's doing so much. Just speaks volumes about our community and what is going on. I just want to say thank you so much. And along with that, we have our census, and we're above the national average, so great. But I'd like to plead to everyone who has the cell phone, if you haven't done your census already, just hop on. It's really an easy thing to do. And that is one of the biggest things you can do for our community to make sure that we're going to get the money, the funds needed to be the safety net for our community for the next 10 years. And I really like to make sure we are pushing the census right now. I know there's a lot of things to focus on, but that is one that we really need to get going. With that, I just want to say thank you. I'm sure I'll say thank you so many times, but to Mr. Powers, all the staff, all those employees that are watching right now and changing what they do to help the community in every way. I just want to say thank you so much. And then I will adjourn on the memory of those on this list that I'll be turning in. Thank you very much.
Madam Chair.
Yes, Supervisor. Sarah, go ahead.
Madam, let me, my apologies. I wanted to thank the National Guard for helping at Food Share, and I wanted to go over to visit him, but due to the stay-at-home conditions, I have not gone over to thank him. But I want to thank the National Guard for all the help they're doing with the Food Share. I've seen a lot of the work that they're doing, packing food and cleaning food, and just helping all the individuals that need the Food Share. Just I want to thank the National Guard. Thank you so much.
Thank you very much. I'll pass it on now to Mr. Powers, CEO comments.
Thank you, Chair Long, board members, and county family. So yes, as Chair Long mentioned, there's a lot of information going out every day, news releases on the updates on the numbers and some more information on total tests and those recovered. So trying to share more and more with the community, and there will be also starting today a regular news conference with KEYT. So we're touching every platform in addition to social media, Facebook, Instagram, Twitter, news releases to the Star and Acorn and so forth. So just on every front, and then people give us other ideas and we'll follow those down too. So appreciate that. Also, just you mentioned the census, Chair Long, and yeah, so far we're at the state rate of participation is 27.3. The federal national is 28.1, and Ventura County is 31%. So 31 compared to 27, 28. So it's good. It's a good trend. We want to keep that momentum going. Ventura County is really delivering on the census. So thank you.
Thank you very much. And with that, we will now start with a report regarding the COVID-19 and associated updates. So, Mr. Powers.
Thank you, Chair Long, board members, and community. So I appreciate the time today to update on where we're at in the counties and the community's COVID response. And just amidst all the information that's out there, I've been sort of reflecting, I think as we all have, of how to sort of capture the message. And what I've been thinking about is it's time for our community to find our historic clarity about what we need to be doing right now. And I have a couple of points that I just want to touch on that I think help bring it to, certainly for me, and I think others, is we see the numbers and it's just hard to believe it. There are people dying in our community right now because of this virus. There's their number on a sheet, but they're more than that, of course, and it doesn't seem real, but it's real. And so, I know that's bringing it home to a lot of us. Our healthcare providers right here in our community, our neighbors and friends are those healthcare providers. They're putting themselves out there at risk for us. And it really came home to me last night. I had the privilege, along with Supervisor Bennett, of touring with Dr. John Fankhauser, the CEO of our county hospitals, of touring the hospitals and just really trying to gauge just a little bit with the nurses and the doctors and see how they're doing. And it really left an impression on me, and I'm sure it did the supervisor. Just that the looks on their faces. I've known some of these nurses for a long time, and that you can understand that they know something's coming, and they're clearly worried about that. But at the same time, I saw a lot of calm and resolve that they're ready and that they're willing to take it on and do what they have to do. And it was powerful just to see the looks on their face. And there's a couple stories that really brought it home too. Is we were talking to the emergency department manager, Jessica, and she is already self-isolating from her family for the last 2 weeks, and she has a 9-year-old daughter. And so she's going to have to do that for longer than that. And I just thought, boy, that brings it home. And they do a lot of FaceTime, which she said is good, but her daughter wanders away mid-sentence sometimes, forgets she's on the camera, and then comes back. And then Jessica also mentioned that there's a group of ER nurses that have rented a house so that they can stay there to protect their families, from the risks that they're taking for us. I just thought, and just their humility. I mean, they're not asking for anything. They appreciate the support they're getting from the hospital and healthcare leadership and the community. They feel it, and the signs and the posts and all the things that they're getting. I think they feel it, and they're ready. It's very reassuring to see these professionals ready to protect our community. And the last point was the doctor's letter that so many you have seen from Doctors Cox, Mishkadi, and Barger. And there were 2 points that I just want to reflect on real quick. And one, I was talking to our fire chief, and he was saying, this is unusual for us. This is not a fire. We're used to being on the front lines of things. And so he's obviously, they're doing a great job of supporting. But there was something in the letter that did make me think of how it compared to a fire. It says, human interaction is the fuel that spreads the virus, like dry brush in a wildfire. By staying home, when we deny the virus pathways and carriers to spread, the virus, like a fire, starves. After weeks of sheltering in place, if nothing much has happened, we'll know the sacrifice made all the difference. And I just thought that was, when we're trying to look for analogies to what this is like, this very novel, unprecedented situation. The other part that I thought struck me in the last part was they talk about the threat to the community and the danger and so forth. But what they didn't say, and I read the letter several times, they said that this is a threat to us and our families. We're putting at risk, if people are not social. They never said that. I thought, well, but here's what they did say is, in spite of all that threat, that we are here for you. We are preparing for the surge every second of every day, and we will care for you. And I just thought, what an incredibly selfless perspective to have. And since they won't say it, that's what that we are doing, is saying that we have an obligation to those doctors and nurses and first responders and social workers who are out on the front lines of the community protecting us. And you look at other countries where maybe they have a little bit more heavy-handedness in their approach to things, but we have a lot of freedom here, and we love our freedom. That's who we are as a country. But it's also a gift and a responsibility, and I think more than any other counties, I know this county is going to choose to do what's right for the health of everyone in our community. And I'm just thinking of how great it's going to feel when we do rally, and we are rallying, and we're going to hear from Dr. Levin later about how things we're doing. There's a lot of good things happening, right? A lot of sacrifices are being made by businesses closing and jobs lost in schools. Schools closed, which is hard on the teachers and the parents. If my wife has a few more days of sheltering in place with my boys, she's going to need some major social distancing, and I'm sure she's not alone. But it's just the community is already sacrificing. Physicians are doing telemedicine with their patients, and just how great it's going to feel when this Ventura County strong community rallies to protect our community in the weeks ahead. So a couple other quick updates. Enforcement, we had a good meeting on Friday with the sheriff and local police chiefs, the district attorney, as well as the cities, and Dr. Levin and Rigo Vargas, to sort of talk about what are the next steps. And it was just very reassuring to hear that public safety is completely on board and out front, educating the community and doing great enforcement here. As I say, it's not this way in every other county, and we're very lucky. But they also recognize they need to step it up to the next level. So we're preparing a cease and desist order that Dr. Levin will sign and be served on businesses. There's a ton of compliance going on. There really is, and that's great. But there's some some areas and pockets that we need to follow up on. And I know Dr. Levin's going to issue a new order coming up to clarify some of those areas because, it's a lot of moving parts, what's essential and not and so forth, working with the good guidance of County Council and to get there. And in that same spirit, just want to let you all know that with the support of our GSA leadership, we are going to close all of the parks in the county, all of the county parks by the end of business today, and closing reservations for both day and camping use at county parks through the end of the Stay Well at Home Health Officer Order. All prior reservations for park use updates occurring between now and the end date of the Health Officer Order will be canceled. Campers currently staying at county campgrounds will be vacated by the end of the day on Friday, April 3rd, 2020. And there will, though, be an exception for people who are using their RVs as their primary residence. So appreciate Dave Sasek and Ron Van Dyke and their support and help with that. There's a lot of exciting things going on also with our community, trying to get tests for immunities, and so we can try to get ahead of this thing. We'll update you more on that later, but with that, I will turn it over to an update from our public health leadership. Oh, sorry, yes.
Can I just ask, because of the parks, we've had a lot of questions from our different offices, and the reason for the parks is because of the social distancing. Is that correct?
Yes, it is, Chair Long. There, and one thing that Dr. Levin said, and I really appreciate many things, is people need to get outside and get fresh air. They need that exercise, and that's good. But there's still a lot of clustering in the parks and things, and that's part of the problem. And then folks coming from out of county and things, and so it's just we have to go all in. We have to do everything we can. These next 4 to 5 weeks are critical.
Thank you for that clarification, because I think it helps people to put in the mindset of that. It's not because we don't have the employees.
Oh, no,
it's because of the public safety.
That's right.
And to make sure that we're getting those gaps. Because I've seen it where people said, well, we can come to the park, and then they're gathering in 10s, 20s to talk to each other without any social distance, which kind of doesn't do the job. So I really appreciate that. So thank you.
Thank you, Chair Long.
Supervisor Zaragoza?
Yeah, Madam Chair, to Mike, you said about the parks being closed. The question I have is, how about Hollywood Beach and Silver Strand Beach? Are they going to be also closed? Do you know?
We will, Mr. Van Dyke, do you have Ron Van Dyke, our Parks Director, will clarify that, Supervisor.
Thank you.
Thank you so much. Okay.
Yeah, we're working in concert with the Harbor Department, so he's following our lead, anything that we do, along with the City of Ventura. We've been in email contact with their Director of Parks and Rec, and they were waiting to see what the county did. So I fully expect Ventura City to also lock down their parks as of today.
My understanding on the beaches, Mr. Van Dyke and Mike, is that the beaches are closed in LA County, and folks supposedly are coming to Ventura County to use our beaches. So we wanted to find out if they're going to be closed, or what is the status of those beaches at Hollywood Beach and Silver Strand.
I can answer the beaches that we have control over. The Harbor Department can close those with this order.
Right.
The rest of the state beaches along our coastline are currently open. The parking lots were closed by order of the state Park and Rec Department, but unfortunately, especially the area between Emma Wood and Hobson, that stretch of beach there, the Rincon Parkway, as everybody knows it, is a combination of Caltrans and State Lands Commission actually would have to work in concert to shut down that road and beach access. State Parks Chief Ranger is in touch with his boss to look at that. The fact that we're shutting down, they may take the next step and shut down, but currently the parking lots are closed, but the beaches still have access.
Yeah. Thank you, Van Dyke. Mm-hmm.
And so on
Chairman Long?
Yes, Supervisor Bennett.
Yes, we pointed out one reason for doing this is because of the lack of social distancing by some, at the parks. But I just want to emphasize two other reasons for doing this. The whole issue here with stay safe at home is we're trying to decrease just the overall movement of people, because with each movement of a person, you increase the movement of potential viruses. And so by having our parks open, and that could potentially attract people from outside of the county to drive here, And so if we have longer trips or more frequent trips, both of those are negatives for trying to decrease the movement of the virus, which can be transmitted with people unknowingly that don't even know that they have it, because this thing could be asymptomatic. So I would offer that that's another justification, even if people said, "Hey, we're doing social distancing." Just the fact that people are traveling long distances and traveling more often because the parks are open, um, that's a negative for our efforts, and particularly our efforts, as Mr. Powers said, to try to honor the risk that our frontline um, healthcare professionals are taking every day when they work with contagious COVID patients. Thank you very much.
Thank you very much, Supervisor Bennett. Very good points.
Thank you, Ron.
Thank you, Ron. Appreciate it.
And so with that, there is tremendous coordination going on, of course, with our public health leadership, with Sheriff OES, the EOC, the Emergency Medical Services Agency, as well as our cities, regular calls with the cities, community-based organizations, and schools. So, and they're working round the clock, I can tell you, as you can imagine. I appreciate them being here for updates today. So, Mr. Vargas.
Good morning, Mr. Powers, Chair Long, and board members. Thank you again for the opportunity to give a quick update on the numbers. But before doing that, I'd also like to just thank your board, CO's leadership, the county family, HCA leadership. It's been a tremendous team effort. Obviously, it's a health crisis, but it's also a countywide crisis that's affecting all sectors and the entire community. Also very grateful to our healthcare partners out in the community, the hospitals and the long-term care facilities. Everybody's on board and doing their best and working closely with everyone, including and obviously our department. So just to highlight a couple of the numbers that we are reporting on Ventura County emergency.com. So as you know, we've reached over 100 cases of positive COVID-19. We have 126 as of last night, and while you know it's 126 out of the almost 6,000 in California, it's still confirming that this virus is transmitting locally. And even though the numbers are increasing sharply, it is expected on the one hand, not only because there is local transmission of the virus pretty much in every community, but also because there is increased testing. And in the numbers that we reported yesterday, you know, we showed that over 2,200 tests have been conducted in Ventura County. Your public health lab has done over 1,200 of those tests. So we continue to be busy. The staff are working around the clock. They're in by 6 in the morning, and they're out, you know, around 8 o'clock, 9 o'clock, sometimes later than that, at full capacity in terms of what the machine allows us to run, which is about 100 tests a day. And lately, we've been running that many tests. And so I'm very grateful to our all of our team at Public Health, EMS, obviously our health officer, everybody working around the clock. But specifically, our lab has just been outstanding their work, and also our communicable disease team is working around the clock, following up still with and attempting to contact all those 126 positive cases to make sure that they're isolated, that they're if they're in the hospital, that the hospital personnel know, get confirmation that they've been positive, and check on their family members and other close contacts. The unfortunate news is also is that you know, not only did we report previously the one death, but now we have 4, and there's 2 that we're currently investigating that might add to our tally. So unfortunately, and very tragically, this you know, infection is leading to fatalities, to deaths of our residents, and it's very sad. Our you know, our hearts and you know, are heavy with those losses, but there's probably going to be more, a lot more, in fact. And we're doing all that we can to prepare for that, and you'll hear more about the ongoing efforts of everyone to just you know, prepare as best we can. And definitely the message is stay well at home and stay safe, because that's the only way we're going to you know, help with the surge that is expected nevertheless. I want to just touch a couple other quick things regarding our partnership with 211. They've been a great partner. In fact, this morning they reported to us that they've had over 1,500 calls that they've responded to on the phone live with a resident of Ventura County that's called for information around testing and how to protect themselves and just numerous questions. And that's 1,500 direct calls that they've assisted with, but they've also sent out over 31,000 texts to the residents also. So there's a great communication going on via text. So 211 has been a great partner. We really appreciate them. And while they've been taking the brunt, the load regarding calls, our team of public health nurses and Ventura County Medical Center leadership in terms of physicians and others have been also on call for calls that go to 211 but need to be fielded by nurses and doctors. And so we have, in fact, 3 call centers still, and even with our partnership with 211. One is to be able to provide direct assistance to providers. That's one line. We also have a public line that's mainly through 211, but if they can't handle a specific question, it gets routed to staff. And then also we have a dedicated line for employees regarding testing and questions that they have. So we're busy also with those call lines, and we really appreciate everybody that's helping with those. I've just conclude again with being very appreciative of the support of everyone, and it's just great to see how, in fact, Ventura County rallies around situations, whether it's fires and in this case health, and we are indeed Ventura County strong and very proud of the efforts. But more to come in terms of this situation. We hear what's going on in New York and in Washington. And while we don't expect to be in that same situation, nevertheless, it's going to get worse before it gets better. And so I'll end my comments here and turn it over to our public health officer, Dr. Levin, followed by our EMS administrator, Steve Carroll.
Rigo, before
Yes.
you go, could I ask you a couple questions? Well, first of all, was Channel Islands University, CSU Channel Islands, we're not recording any cases if there were any there, correct? Is that because it's a state area, or do we actually report those? Someone had asked me, and so.
Yes, I saw that inquiry. So we report Ventura County residents' numbers, and so I'll follow up to see if I don't believe we have records of students that live in that are of Channel Islands. But yes, our numbers are specifically of Ventura County residents. Okay. So I'll find out.
Thank you. And the other question that I've been receiving is, I think people are very much interested in data mining of this. I think we've had the questions of, okay, so in Camarillo, if there's 21 cases, what are the age range? Is the kids getting tested? There's a lot of different questions, and I wanted to make sure we just touched base on that. So right now, the information that we're giving is very valid because it's for all of Ventura County, correct? If we go more in depth to each city, is there going to be as much value to that, or is it better the way we're showing it?
Yeah, we clearly want to be transparent and share our data. Now that we're over 100 cases, we've begun to report that information a little bit more by different areas. So, I mean, I think for the most part, we've been very consistent, in fact, with other county health departments, the way they break down, and with the state, the way they break down the age groups, and also in reporting by city, and then also by community, whether it's an unincorporated area or just a community. And so I know there's been a lot of interest and feedback, in fact, about our reporting by unincorporated area or not, and we're working to fine tune that reporting. It is very important that we are very accurate with the data in terms of each community. But yes, as the numbers increase by city, we might be able to break it down further. But while every city now has cases, there's a few that are even less than 10. So to break down further at this point, I don't think we'll add particular value breaking it down by city. But again, I really appreciate the interest around the numbers. But clearly, I think the main message is that this virus is in our community, and we needed to remain vigilant around, if someone's sick, to check with the provider about getting tested, whether it's a youth or a senior or somewhere in between. And so we're leaving it up to the provider and to the individual to determine whether testing is needed. Obviously, our public health lab and our hospitals are priority in terms of the testing that comes to us and who does the testing for our first responders and the seniors and other high-risk groups. But testing is readily available by commercial labs, and so that for those tests, it's up to the patient and the provider.
Thank you very much. And I think you hit a point very strongly. No matter what the data says, we should be staying well at home so that we're not spreading this disease, no matter if it's a certain age or a certain location. We should be all doing our part no matter what. So I appreciate that very much. Thank you.
Chair Long?
Yes,
Madam Chair.
Supervisor Parks?
Thank you. Regarding Cal State University Channel Islands, I wanted to mention we do have University Glen there, and it's a significant population. And I do know that lots of people want to know about their areas. I would err on the side of transparency. If we have the number breakdown, for example, Oak Park in my district is one of the largest communities in unincorporated area, and I just want to be able to help them get the information. Thank you.
Thank you, Supervisor Parks. Supervisor Zaragoza, you had a question?
Yeah, Madam Chair, for Rigo, I want to thank you, Rigo, for continuing to convey all this information in Spanish and Mixteco. I think it's extremely important that we do that every single day. I think it's extremely important that we convey our messages in Spanish and Mixteco. And thank you, Rigo, for having your team and Mike, our team too, well, all of us for that matter. Thank you.
Thank you.
Thank you, Supervisor Zaragoza.
All right.
Dr. Levin?
That's fine. Thank you.
Good morning, members of the board, Chair Long, and Mike Powers. Mr. Powers sent to me recently a headline from the New York Times that read, "Restrictions are slowing coronavirus infections, new data suggests." And yeah, we know that. We know that by the restrictions we've placed, we're going to reap the benefits of this. It's hard to know that we are doing that. It's hard to document at this moment that we're doing that, but it is happening. A Norwegian company that tracks cell phone usage has looked at counties throughout the United States, and they've recently reported that, and they've scored the counties on their the amount of quarantine and social distancing that the counties have done. San Bernardino and Kern counties received Ds. SLO, San Luis Obispo, received a B. Ventura received an A. But an A is not good enough. We want A++. We're doing great. We are an A county, but there are a number of places that aren't doing what they need to be doing, and some individuals that aren't doing what they need to be doing to quarantine themselves, their families, and to socially distance. We need to look at ourselves. This thing is important. We are facing a tsunami of cases. We saw 20 some odd cases, new cases yesterday. That might seem small in a couple, 3 weeks when we're seeing 200 or 400 in a day. That's going to have a huge impact on our hospitals. It's going to have a huge impact on our death rate. We have approximately 12 people who have died this year from influenza in our county. Our biggest year that I know of in the last 21 years was 2 years ago when we had 49 people that died from influenza. We could potentially have 1,000 people die in our county from COVID. Now, the actions we're taking, we hope will curtail that and diminish that significantly. But this is not influenza. This is much more serious, and we have to take it seriously. And it starts with us and keeping ourselves from getting this infection. Because if we don't get it and everybody else has the same attitude, we're going to really snuff this out, and we need to do that. Yesterday, the health department, we spoke with hospitals and told them that we really want them to have holding areas for COVID-19 positive patients. There are patients that are well enough to not require hospitalization. We need to get them out of those beds because we are expecting new patients in those beds. But we really can't place them. The hospitals can't place them yet. Maybe they're still considered contagious. There may be other reasons. And so the hospitals, some of them had already taken this on, and others, I think, showed a commitment to taking this on, having these kinds of units to hold people. We need, and this was also mentioned in our phone call with the hospitals, we need a capacity to have a 50 to 100% surge in our county. So if we've got 12 or 1,300 beds in our county, we need to have the ability to take care of 2,500, perhaps, sick people. And it may be more than that. We don't know yet. We just need to be ready. And I think it's better for us to overdo it, to have too much capacity than too little. When we spoke with the long-term care facilities, we told them that we are committed to keeping COVID-19 out of their facilities. And part of our ability to do this was our hospitals throughout our county, their great cooperation and willingness to help take on these people who no longer are sick enough, COVID positive, but they can't go back yet because they're still possibly transmitting this disease. And so these units will allow us to keep that commitment to our long-term care facilities. We may get so busy with this that we'll have trouble keeping some of these promises. We may have to go to skilled nursing facilities or extended care facilities and ask them for a wing so that we can use it to dedicate and cohort patients with COVID so that we keep them out of the rest of the SNFs and extended care facilities. Returning to the theme of protecting our elders, or continuing the theme of protecting our elders, that's the way to keep our deaths down. That's where the deaths are occurring. And while we still have a PPE shortage, still do, Steve Carroll mentioned yesterday in a call that we've had 3 semis of material, of PPE, arrive in our county. And after that, we still have a shortage. But when 3 semis at a time like this arrive with PPE, you have to ask yourself, what an amazing country we have. Where do we come up with this? How do we do this? And then we have to ask ourselves, who gave us this remarkable country? And I think we have to say our elders did. And so I think we owe it to them. If there's any questions, I'd be happy to take them.
Supervisors, do you have any questions for Dr. Levin?
I do. This is
Supervisor
Steve
Bennett.
Thank you. I'll turn my thing on there. There we go. I know that we've reached out to the large retailers that some of them have not adopted what a lot of us are calling the Trader Joe model, which seems to be a great model in terms of the social distancing that they're practicing. And I can appreciate in those larger big box stores, it's maybe harder to enforce it inside, even if they are regulating the number of people going in. But I have a suggestion that for both our public health officer and our CEO, Mr. Powers, and that is we have some workers that can't practice their normal assignment now, and we're reassigning those people. Could we assign some workers to regularly, and I mean a couple of times a day, check on these big box retail stores where we've had lots of concentrations of people, and keep us updated in terms of the efforts that they're making and what we're seeing. It seems like that is if we could decrease that, we're gradually tightening down more and more and decreasing places where people congregate, but we can lose a lot of ground in some of these big retail stores and large grocery stores that we've now just recently been trying to make extra requests on, that they make extra efforts. So I'd like to throw that out as a suggestion, since we have some employees that should have the time to be able to do that. I'm not talking about taking public health employees who are really busy. I'm talking about taking other employees that we train specifically for this, whose current job they can't perform as readily because of our policy of closing down the government center, et cetera. And that's my basic point here. Thank you very much.
That's a really good suggestion, and we will talk about it. I'll just tell you something that was related to me the other day by Dr. John Fankhauser. He was in, and I'm going to say the name, he was in Walmart, and that place was packed. He can tell the story more effectively than I can, but I guess I'm beating him to it. There was people crammed around the children's clothing section, and Walmart has a valuable function in terms of groceries, in terms of pharmaceuticals, in terms of even hardware sales. But there are many parts of Walmart and other major stores in our county that are selling things that bring people in the door, that promote, that defeat social distancing. And we're going to take steps to ameliorate that situation.
Mr. Powers, did you have a comment?
Thank you, Chair Long. Yes, Supervisor Bennett, to your point, just so you know, our office has been reaching out to the major chain grocery stores. Did reach out to Walmart yesterday, and they agreed that they would comply. So we're getting very good responses to those to that outreach, and we can, as this council has guided us, we can ask some of our reassigned employees to do some checking on that for us, so we're able to monitor that more closely. Thank you.
Thank you.
If I could point one other thing out, Supervisor.
Supervisor Bennett, please.
Thank you. And that is, we have to keep reinforcing the point that it's not just social distancing. If everybody says, well, we all stayed 6 feet apart from each other in the Walmart or whatever, so therefore it's okay. No, people are still touching counters and railings and doorknobs and door handles and those kinds of things. So our goal is not just social distancing. Our goal is stay at home, which we need to decrease the number of trips and decrease the distance of the trips. The farther people go, the more you risk one person reinfecting a community. And the more often somebody goes, you increase the risk of somebody infecting a whole community. So you could have a whole community doing a great job, and one person comes from someplace else and can start the COVID virus starting all over again in that community. So it's not just social distancing, and I think it'd be important for us to emphasize that. It's also decreasing just the amount of time and the number of times people leave their houses for any reason. And, selling children's clothes on sale at Walmart could be an attractive nuisance, is probably the way I might view it at this point in time. Yes, there are some essential purchases, but there are things that aren't absolutely essential. We should be avoiding those trips altogether. Thank you.
Well, Supervisor Bennett, I would agree. We have said that going to the grocery store is acceptable. You need to do it, but maybe we need to be in the mindset of we don't need to go every day there. It's just for that social interaction. That's not what we're protecting everybody. If you need to go to the grocery store, make your list and go for the one time for the week versus go every day for one item in which you're actually exposing more people, which is against what we're trying to do right now, which is stay at home. I appreciate the data on cell phone access. I think we saw that with Florida, how crucial and how packed people were. And to hear that we're an A is great. But I do agree with you that we have to continue as we see fatigue like we did with all the fires and people evacuating and all the stress that goes along that. We're going to see that again here. And in closing the parks, we are going to see that as well. So I appreciate that. Also, I wanted to ask you about the statistics of medicine. So prescriptions, is that something we're going to need to be focused on as well? We have supplies in which we're focused on, but I have a sense that if this gets bigger and the demand is everywhere in the nation for the same type of drugs, that perhaps we need to be looking at that as well. And I wanted to get, since you're all the statistics and everything, get your feel for that.
I think the concern about pharmaceuticals is right behind the concern about PPE. It's not as obvious because the disease is not here as strongly as it will be, but we're already out of some pharmaceuticals nationwide or have shortages nationwide. One of our county residents wrote us and said, you know, pharmacies are on a rigid routine of throwing out outdated medications. And they could be throwing out outdated, so-called outdated medications that are vital to us. And indeed, the medical literature shows that many medications are good for 2, 4, 6 years beyond their outdate. They've only lost 5% of their efficacy. And so we forwarded that complaint, that concern, I should say, to the state.
Thank you.
And that's being acted on at the state level.
Thank you. I appreciate that because I think that's something that we need to be always looking forward. We know it's going to happen and we know that we need supplies, but we also have medicine. But I say that only because we need to make people stay home so they don't need the medicine, they don't need the supplies, so it's not taxing on the system and keeping their families and them safe. So that I just thank you, appreciate that. Supervisor Zaragoza, you had a question.
Yes, I just want to thank Dr. Levin for conveying the COVID-19 message on radio this morning. I think, it's really important that the public hear from him. I know we have the internet and we have the bcemergency.com, but I think that he did an excellent job this morning in the radio conveying some of the information that he shared with us today, the distancing and also the grouping of people in different stores and et cetera. So I just want to thank you, Dr. Levin, for your great comments this morning on the radio.
Good, thank you.
Thank you. And then also is when do you think we'll be hitting our peak? The newscasters, if it's fake news, real news, someone's news, are spreading many different things out there. Today I was driving in and I heard April 29th is the date. And that might give people a lot of good hope. But that's in California. And I know it gets hit one area differently than the other. Like we're not the same speed as LA County is. So what do we do, or what do we say to our public about the time frame? Is it an estimate?
I'm going to be very precise in my prediction. 3 to 7 weeks, and I'm not sure about that.
Well, and I say thank you because the president has stated that we're going till April 30th. But, at what point in what area of the nation is that? So I appreciate that. 3 to 7 weeks, and we don't know.
We don't know. There are things we can follow. There are things we can watch. And we'll bring these numbers out and make them and share them with the public as we go and as we perfect it. See, right now, the problem with questions like, publish the numbers for my city or publish these kind of numbers, is our numbers are so low that there's what we call, there's no statistical significance to them. It's not strong. You need lots and lots of numbers, and sadly, we're going to have lots of numbers. But that will give us better statistics, and then we'll start sharing them when we think we can.
Could I ask for clarity?
Supervisor Parks.
When you're talking 3 to 7 weeks, are you talking until it peaks?
Yes.
Thank you.
That's a good clarification. Yes, 3 to 7 weeks to peak, and then we don't know after to come down, correct? Based on antibodies and so forth. I think what's so hard about this pandemic is it's not like a fire where you can see where it's going and you know when it's going to stop. This is something you can't see.
But another analogy that goes along with fire is before your fire department pulls out, they need to make sure the fire's out, completely out. It can restart. And that is going to be a trial for the residents of our county, because we're going to get on the other side of this curve, and we're not immediately going to stop the steps we've taken. We need to make sure that this is smothered.
Thank you. Are there any other questions by supervisors or Mr. Powers? Dr. Levin, thank you for the explanations. I really appreciate that, and I think our community does as well. So thank you.
Thank you.
And next up, one of the questions that's been foremost on the community's mind is hospital surge planning and the access to PPE. So with that, we'll turn it over to Steve Carroll, our EMS Agency Director.
Thank you, Ashley, for the Clorox wipes. So thank you, Chair Long, members of the board, and Mr. Powers. I'm Steve Carroll, the Administrator for Emergency Medical Services, and my notes keep getting bigger, so bear with me. In response to the COVID-19 emergency, Public Health, EMS, and our system partners are continuing our preparation efforts and response activities. 911 dispatchers are continuing to screen callers for symptoms consistent with COVID, and this week we modified those questions to include gastrointestinal symptoms such as abdominal pain and nausea, vomiting. We're also pre-planning for potential changes in our dispatch guidelines and recommendations, which could change our response unit configurations should our call volumes increase dramatically in the future. On the EMS provider side, last Friday we adjusted our guidelines for our fire and ambulance partners to recommend basic personal protective equipment on every call. That will require a basic mask, either a surgical mask or an N95 mask, eye protection, and gloves on every patient contact. We found that this was necessary due to a review of some of the unprotected exposures to COVID-19 patients that later became positive that were not previously determined in our previous guidance. They weren't found in our previous guidance as recommended for PPE. So we felt it was necessary to increase that. We also have developed a partnership with Los Cesos Medical Clinic and the Public Health Lab for consolidated testing of our symptomatic first responders. This provides a uniform process to assess the status of personnel that become ill while on duty or shortly after their shifts, and also where other first responders, coworkers, or patients may have been exposed. We've also implemented twice weekly conference calls with our executives and our EMS leadership for our first responders, and also with our executives and our emergency managers and emergency department staff for their hospitals. Those calls are designed to provide situational awareness, situational update, enhanced communication, and coordination amongst all of our stakeholders. Our 8 hospitals are actively engaged in responding to COVID-19. All have activated their hospital emergency and medical surge plans, and they're working to further increase our local bed capacity. As Dr. Levin mentioned, our current surge plan or we potentially may need to double the capacity. Our current surge plans provide for about 600 additional beds within our system of our approximately 1,250 licensed beds. The hospitals are working actively to try to enhance that and increase that capacity even further. Some of the activities that they're doing at the hospitals include increasing the isolation and ER capacity at the existing hospitals, as well as reactivating the old sections of the hospitals and also increasing med-surg, telemetry, and ICU beds. Some of the hospitals also added tents to add additional capacity and as well as to isolate potential COVID patients from infecting areas within the hospital. We've also activated our daily polling, as I mentioned last week. That polling is providing a snapshot of our hospital status, including daily census, available beds, available ventilators, and the number of COVID patients among a bunch of other COVID-specific questions that they're asking. Staffing, of course, remains a constant challenge and concern, and all of our hospitals are looking at ways to reallocate resources within their facilities from areas that are not receiving patients and reallocating those resources and staff. We're also looking at ways to mobilize volunteers and other available workers to augment our healthcare workforce. Another area of concern recently has been the number of ventilators available in Ventura County. All of our hospitals are working to locate additional supplies of ventilators, and we're also continuing to request ventilators through our state resource request process. Unfortunately, almost all of those options are backordered at this point. Ventura County EMS, a few years ago, we did acquire a handful of emergency ventilators from the state surplus. Those have been taken out of storage, and through a partnership with our hospitals and their talented biomed folks, those ventilators are being tested and prepared for emergency service. Once those assessments are completed, we hope to add about 50 additional emergency ventilators to our hospital supply. Our healthcare coalition is continuing to communicate with all of our healthcare system partners, and along with our public health team, they're continuing to work diligently with our skilled nursing and long-term care facilities to increase communication, provide guidance, and also to provide appropriate supplies. Our Emergency Operations Center, led by Pat Maynard, continues to provide planning, logistics, and coordination activities. One of these efforts that is directly related to our medical health side is the medical health desk at the EOC is ensuring that we have appropriate medical supplies and personal protective equipment to all of our healthcare workforce. Through the partnership with our hardworking EMS and OES staff and our amazing team of collateral and volunteer workers, we're actively processing dozens of orders daily. In the past 3 weeks, we've provided approximately 35,000 masks to clinics and long-term care facilities, over 40,000 masks to doctors' offices, home health providers, and other ancillary healthcare workers, over 150,000 masks to our countywide public safety partners, and over 350,000 masks to our hospitals. This is in addition to a number of other supplies such as gloves, goggles, gowns, and hand sanitizer. Continuing to work with our system stakeholders and our regional, state, and federal partners to request additional needed supplies as it comes up or as anticipated. Our isolation gowns, face shields, and specimen collection swabs still remain a scarce resource, but we're continuing to look at options for those. While the EMS and hospital systems have increased recommendations for routine PPE use, we're still recommending conservation efforts to reuse masks and to minimize unnecessary waste. Unfortunately, there's been a lot of misinformation about our PPE availability lately, and contrary to that message, I believe our healthcare system is well prepared and exercising sensible PPE conservation plans to ensure our healthcare workforce has the needed supplies while protecting against unneeded loss or waste. The health and safety of our healthcare workers and our first responders remains our top priority, as they are our primary patient care workers that are dealing with us on a daily basis. I'm available for any questions.
Thank you very much. Supervisors, do you have any questions, Ms. Carroll?
Yes, I do. This is Steve Bennett.
Yes, Supervisor Bennett.
Thank you. Mr. Carroll, I know this is a huge concern of lots of people, and I get lots of questions and stuff, and I know you guys are working really hard on it. Could you help us just identify for the board and for everybody in the public, so to the extent that we can help either with public pressure or in other areas, where are the bottlenecks in terms of surge capacity? I suspect that we actually, with hospitals that have been closed down recently, or that we've moved, we actually can find the space to put the hospitals. But my first question is, do we have enough beds for the spaces that we've come up with? So let me just start by that question first. Do we have enough beds for 50% surge increase? You talked about us expanding by 50%. Do we have enough beds for a 50% expansion at this point in time?
So we have enough capacity, and we're assessing that right now. But the hospitals are all working to add additional actual beds, as well as they all have supplies of cots. We have a supply of cots, and we're also going to be reaching out to and looking at all options to enhance our availability. It may not be a standard hospital bed, but we will certainly have additional resources. We have Red Cross that we can access their additional supplies for their shelters, that we can put those cots into service. We have a supply of medical cots, and the hospitals all have cots, as well as they're working on trying to augment their actual bed status, their bed capacity at the individual hospitals.
Okay, good. So my second question is, it seems that it's personnel to staff that. I mean, we have this many more people. We already have challenges with personnel, just for our normal staffing here. In that situation, is there any value? And I asked a question, and I'll just leave it as that. Is there any value in us doing some advanced training with volunteers so that we get them up to speed to staff a 50% expansion, where we may have to, bring in retired docs and retired nurses and people who are willing to step forward if we're really starting to get overwhelmed? Is there any value in starting that kind of training with that group of people right now?
So we do have a couple of different options. We have a small but mighty medical reserve corps that will be, they're actually already activated and helping us in a variety of different functions. We have the state's disaster healthcare volunteer system, where medical folks can actually register. We have a few hundred folks that are already registered on that site that we can try to activate those folks. As far as planning and preparing for those, or training them in advance, we haven't got to that place just yet. It may be something that the individual hospitals or the location that they would be going to would have to do just-in-time training, because they may be specifics that they would be needed for the actual job that they'd be requested to do that at that particular time. So we'll be looking at that, and it is something that we're actively pursuing to see if we can augment what the hospitals are already been able to do.
And then could you identify what of the PPE material and supplies, is it the gowns that we would have the most difficulty with in terms of if we had to surge hospital capacity? At this point in time, our gowns are our biggest problem out, and respirators.
Yeah, so there's actually a number of things. Masks are generally not one of those top concerns right now. It is gowns, definitely. We have a shortage of face shields for mainly for the hospitals to have their high-risk procedures that are aerosolized procedures, and ventilators can potentially cause aerosolized risk. So they would want those additional layers of protection. So we do have some challenges getting those, although we are finding some leads for that. And then of course the swabs is probably the largest challenge, is that we can't run tests when we don't have swabs.
We don't have swabs still. That's still a crisis.
It is still a severe shortage, yes.
Yeah. All right. Thank you very much.
Okay.
Thank you, Mr. Powers.
Can I just add one other point that I neglected to mention? If anybody's watched the news in the last couple of days, they probably saw the Navy ship, the USS Mercy, I believe, is the one that came to the Port of Los Angeles or Long Beach. That ship is actually designed to augment our region's hospital system, and so there's about 1,000 beds. That they're not taking COVID patients, but they will be available to Los Angeles as well as to our other counties in Orange, Ventura, Santa Barbara, and San Luis Obispo counties, to move patients there that are lower level, just taking a hospital bed, but not necessarily COVID related. So that's another area that we're researching and looking into how we can potentially utilize that resource to lessen the burden on our existing hospitals.
Thank you. Supervisor Zaragoza, did you have a question?
Yes, I want to thank Steve Carroll for his excellent presentation. And one of the things, I know you mentioned quite a few items here, Steve, that you're doing, but one of the things that I'm happy that you're doing is working with our first responders, our firefighters, and our sheriffs, in the EMS firefighters and sheriffs, because I've had a lot of concerns from them when they report to different homes, emergencies that affected from the COVID-19. So I want to thank you for providing the PPE, if that's the correct word to use for that. Thank you, Steve.
Steve, also, the list that has been provided to our businesses has been very helpful, from distillery changing to hand sanitizer, to clothing changing now to masks, sewing. I hear that we're looking into ventilators, how we can do that. Everyone's on a call for 3D machines, so we can do the headbands for the protectors, to umbrella bags and plastic. I think this is really important for our community to get the information so they can help us.
Great.
So I appreciate getting that document and getting the information out so that we can then figure out how to help. Because I know we're all in it together. So please keep up with that. If there's ventilators, if there's beds, if there's anything that we can do to assist, really appreciate it. Master Powers.
Yeah, thank you, Chair Long. Just to mention as well, the governor issued some guidance yesterday to the state director of public health, authorizing flexibility in terms of staffing ratios and credentialing. And I know our CEO, Dr. Fankhauser, will work with our local partners at CDPH on any flexibility that they may need to help expand that capacity, as well as I know they're calling retired workers and so forth and really pulling out all the stops to get folks in. And then later on your board's agenda, you'll see there's a contract for some supplemental staffing for our health system as well that you'll see. And then in terms of the swabs, we have put out a request to all the dentists in our county, our very generous dentists, for help with getting those Dacron swabs. So we'll keep you posted. Thank you.
I appreciated you bringing that up, but that's great. Thank you.
Chair Long?
Supervisor Parks.
Thank you. The letter that was referenced earlier from our doctors mentioned that we will need 18,000 ventilators to take care of the sickest patients at the peak of the surge on day 58. Yet we have only 180 ventilators across the 8 hospitals in Ventura County. And they say if we do well in terms of sheltering in place, we can reduce that number significantly. My question is, are we able to look at rigging those ventilators so that they can be served by more than one patient? And they're saying if we do shelter in place effectively, we can reduce that huge figure down to just needing 475 ventilators, which is still 3 or 4 times more than what we have. So I understand there are individuals out there that have actually been able to take a ventilator and use it for up to 9 people, down to 4 people, instead of 1 per person. And I'm wondering if that's something that we're investigating.
So we actually did receive, thank you, Supervisor Parks. We did receive a inquiry from actually a local veterinarian that I passed on to all of the hospitals that had come up with a product or a potential option to move a single ventilator into a 4-person ventilator. There's a lot of complexities and a lot of challenges that come along with it. Everybody isn't at the same volumes and oxygen ratios and all that, and things that are going to be way above my pay grade, but we went ahead and moved that to the hospitals, and they're having their folks look at it to see if there is options. I know some of our hospitals already have the capacity and the capability for some options to be able to expand the use of a single ventilator. So we're looking at all of those options right now.
And I just also want to extend my thanks to you, Mr. Carroll. You have been doing such yeoman's work and doing it so well. Thank you for all that you're doing.
Thank you.
Thank you. Mr. Powers, do you have any other? Yeah. Steve, thank you again. Please let us know whatever we can do to help.
Excellent. Thank you.
Only thing I'll add is I think the doctors very eloquently were making the point too. That those numbers are if we don't do anything. And so they're really urging that social distancing, and that's the point they're making, is that the numbers are exponential, and the difference, the good side of that is the difference that we can make is exponential too.
Right. Agreed.
Well, that we'll hear from our leadership of our health system, and Dr. Fankhauser, and then Dr. Cho. Thank you.
Thank you, Mr. Powers, Chair Long, and supervisors. Appreciate the time to get to share what's going on at the hospital. As you can imagine, the hospital is basically spending the majority of our time on COVID response for the PUIs that we currently have in isolation in our hospital and preparation for the surge that we anticipate in the hospital. In addition to that, we continue to care for the community that's coming in with the issues that commonly bring people to the hospital. We've closed elective surgeries, but certainly continuing to manage patients who have urgent surgery and continue to manage patients who have illness that brings them into the hospital without the need for isolation. With regard to our COVID preparation, we have adopted the standard of people coming into the hospital all wearing masks. Greatly appreciated the chance to round with Mr. Powers and Supervisor Bennett last night. It was, I think, just a reflection of what a remarkable county that we have, that our board and is represented in that level in our hospital. And I think one of the things that came across during that time was just the tremendous team that we're working with. People who are, as Mike mentioned, making amazing personal sacrifices and yet reflecting their commitment to serve and their commitment to our community in a way that is truly heroic. In addition to those within our own hospital, I think we are reflective of the partnerships that are helping us dramatically, both Rigo and Bob Levin's interactions from public health and guidance and assistance in kind of getting the labs for our patients and interfacing with the public on our behalf. And then, as Steve mentioned, just a tremendous resource from OES and EMS helping us continue to protect our staff, and in doing so allow us to continue to protect our patients by keeping our workforce healthy. In addition to our own county partners, there's just been a tremendous number of community partners. I think we talked last week about the masks and the face shields, and those are all coming to us now, and that's been a tremendous support. In addition, we've had local business people helping us. We have a philanthropist in our community, Jim Knights, who's running the Ventura Global Health Project, who's turned his attention towards helping us in our healthcare system here, and that's been a great resource. Dr. Cho can share a little more about a design that one of her neighbors came up that will help us with gowns, and people from Patagonia helping us with sewn cloth gowns. World Central Kitchen helping feed our folks. Roxanne Packham's design, who's helping us. What we realize is we have to not only focus on patient care, but also the care of our healthcare workforce. And you heard about some of the folks who are already social distancing. We have doctors living in tent trailers. We have the nurses staying in homes and isolating themselves. But there are a number of people who just need to step away from their family for 3 or 4 days while they're monitoring themselves. Or even if someone does get ill, we want to be able to have a small studio-like apartment for them. So we're putting together small studio apartments in an old closed-down section of the hospital. That's a clinic that's no longer being utilized, and having community partners help us with those studio apartments has been tremendous. One of the efforts that we're doing right now is really the next step, the surge plan. Where are we going to go in next? How are we going to create the COVID ward that's coming? We know, and what will be our triggers, and that will be the work of today and tomorrow. We've made some changes in how we're doing work in the operating room just to protect our staff and. We have had the advantage of having a couple of our global health fellows come back to Ventura because it's no longer safe for them to be overseas. One of them arrived today, or yesterday, I'm sorry, and one of them will arrive in a week or so, and they will be tasked with helping Dr. Flossie in the I almost said Ebola response, in the COVID response efforts there. And then finally, I just want to acknowledge the value of the job fair that we had. We're bringing 8 nurses on board from that right now. And then we're coming to you with a request for a contract with a nursing staffing organization. And we've had an exchange with them. They do have ICU nurses and ER nurses that are available, and we anticipate being able to augment our staffing through that Hoffmaster contract as well. And I just represent the hospital and just again want to acknowledge just the tremendous dedication and commitment of our staff and our physicians, and I want to assure you that it's a team that you would be truly proud of.
Thank you very much. Supervisors, do you have any questions for Dr. Frankhauser?
Steve Bennett does.
Supervisor Bennett.
Dr. Frankhauser, how about our retired doctors and nurses? Are we getting many of them stepping up to volunteer, and do we have a specific way for them to sort of tap in and us to be ready to tap into them and all of that?
Yeah, so the medical staff is reaching out to retired physicians, and there is a way, and especially now that the state has put out this report recently that allows some of the regulations to be expedited, and we're reaching out to nurses as well as respiratory therapists. Those are the 3 areas that we're in most need. So yes, we are looking at people who've recently left our system and folks who are retired and asking them to consider coming back when the surge hits.
So is somebody in particular assigned to that task, or?
It's the 3 departments: nursing department reaching out to nursing, respiratory department reaching out to respiratory therapy, and the medical staff office reaching out to physicians.
Great. Thank you. And the only other thing I just want to point out, just to go on record, for the benefit of the public watching, Dr. Frankhauser has extensive experience with the Ebola crisis with his time in Africa, and for the members of the public served by VCMC, it should give them some extra comfort to have such an experienced person here doing that. And so we're not happy that you went through that experience, Dr. Frankhauser, but we're certainly appreciative that you're bringing all of that talent to Ventura County right now. Thank you.
Thank you, Supervisor Bennett.
Thank you. And then also, I just wanted to hit, in case anyone is watching, with the governor's new healthcare workforce initiative, what this was announced yesterday to combat the COVID-19 surge, and they're asking for active healthcare professionals that are active licensed, public health professionals, medical retirees, medical and nursing students, or members of medical disaster response teams in California are encouraged to join the new California Health Corps, and that can be provided on at the governor's website. But I also would love to make sure we utilize those locally. Why travel when you can help your home team? And so I want to make sure that we have that avenue in which those people can reach out to us, because I think we have an amazing amount of experienced people and also students that would really want to help So I hope that we get on that. I know it just happened yesterday at noon, and we're very responsive, but I wanted to make sure people understood that that is available to people. So thank you. Dr. Cho?
Good morning, Chair Long, CEO, Mr. Powers, and Board of Supervisors. I have a brief update from the ambulatory care side. We continue to offer testing for people who feel that they have COVID symptoms and also have had some known exposure or are at increased risk based on age or underlying medical conditions. All of our sites are able to provide the testing for such patients. Again, keeping in mind that we do have the 3 drive-thrus that are focused on doing these tests at AFMC, Las Islas, and Sierra Vista, which is out in Simi Valley. We continue to see about 20 to 80 cars per day, and that's even with the screening activity on the phone to see who would be appropriate for coming through those lines. On the clinic side, we're really pushing telehealth and virtual visits as a means of keeping our staff safe, our patients safe, as well as minimizing the use of PPE. We are trying to strike a delicate balance between using PPE to protect our staff who are at work, but having enough to get us through this crisis. So recognizing that we really want to keep our healthcare workers safe, we are trying to make sure that they have what PPE they need when they're coming into direct contact with patients, such as the masks and the face shields. We've worked on streamlining a process for testing our healthcare workers. They are on the front line and unfortunately do fall ill sometimes, and we do need to have a streamlined way to test those folks, and if they're negative for COVID, getting them right back into the workforce. So we've been working on a streamlined way to get them tested at the AFMC site. Our first responders, as Steve Carroll mentioned, are being tested at the Las Islas site, so I think we have a good process by dividing the work up and in partnering with Public Health Lab, which has been really crucial in getting us those results right away. So that's for the healthcare workers, our first responders, and our frontline workers as well that work for the county. The other thing is that we're waiting for the surge, as you all know, and what we're doing is kind of coming up with creative ways to have enough PPE for staff. I know Dr. Fankhauser mentioned one thing, which was gowns. So I do have a friend, Mihang Bak, who's a pharmacist and also has a very creative side. And she created a trash bag gown by using an iron to iron on the sleeves. And it's quite watertight. And we had a couple of the doctors try it on. So she created a prototype that the high school students in Camarillo are going to use to make more of these gowns. And I know Amy Towner has an entire army of community volunteers who will also be using that same sort of blueprint to make more of these gowns for us. Dr. Sun Lee, one of our pediatricians, has become our goggles MacGyver, and he has come up with a way to use construction type goggles and use snorkel straps so they can be wiped down instead of the typical fabric or elastic straps that come with those devices. So we're thinking of lots of different ways to be creative and stay protected. So I just wanted to share that with you.
I think that's so great. My young is amazing. She's just awesome. And Sunday, I was just reading yesterday for Mammoth Lakes. Many of Ventura County goes up there, and they're told, please do not come. Our hospital system is taxed, and they put out a thing for goggles, for ski goggles.
Sure.
Of just, if we're by the beach, we have all sorts of swim goggles and diving goggles. Let's use that, or construction and so forth. So it's just wonderful that we're thinking out of the box to really protect our first responders. I mean, it's just amazing. Mr. Powers.
Thank you, Chair Long. One other thing that you're doing is maybe you could touch on the telemedicine.
Yes.
And phone visits that you're doing.
So we did launch that for 160 users across the county agency, and we're using a product called DoxyMe, and what it allows is a link sent to the patient on their smartphone that they can just tap and link into their physician. There's even a virtual waiting room so that the physician can see who's waiting and take the next patient in. And it allows patients to do that without having to download an app or use anything complex. If a patient doesn't have a smartphone, we're still offering phone visits, so we have other ways to make sure that we stay in contact with our patients. And then just to remind everybody that if you are ill, our urgent cares are open to see you. I know everyone has a stay-at-home order, but if you're sick, and you need medical attention, we are open for you.
So would they call first and then come in and set
It is
up
very
appointment?
helpful if they call first,
Okay.
so that the staff is prepared. They can have a mask for you right away. The mask on the symptomatic patient is one of the best ways to keep our staff safe. So it is very helpful. We typically have a designated drive-through or drive-up area where the patient can park and the will come out to you.
Okay, thank you. And I think we've used that as a family just this last week of calling in, and it was extremely helpful for both the protection for the doctor and the patient to make sure for allergy medicine and different things, because we still have life besides the COVID-19. So that's really important that we're all having there. I also wanted to say thank you for the criteria for how to get tested. It is on our vcemergency.com under the healthcare providers.
Yes.
And that has been important for educating our community as to when should they get checked out. And again, it's still the same, call your provider,
right?
Primary care doctor. Okay.
Correct.
Thank you very much. I appreciate it. Supervisors, do you have any other questions? With that, thank you very much.
Thank you, Dr. Cho. Next up, we'd like to hear from our sheriff, Bill Ayub, and Sheriff has just been an incredible partner and his whole team throughout this whole process. So thank you, Sheriff.
Well, good morning, Chair Long, members of the board, Mr. Powers, county staff. For the record, Bill Ayub, Sheriff of Ventura County. Just a quick update. We continue to have our deputies on the front lines looking into complaints and observed violations of our stay-at-home order. By and large, throughout the county and in talking with the other chiefs of the different cities, we're seeing really good compliance. We are seeing mobs at big box stores, hardware stores, and everything. It seems like folks that are staying at home want to get home projects done, and they're taking advantage of the open hardware stores to get materials that may not be necessary, but are helping them occupy their time. So hopefully we do see some greater compliance there with the social distancing and keeping people safe when they're shopping. As Mr. Powers suggested earlier in his remarks, we have had a posture of education versus enforcement. We, like I said, by and large have seen a good deal of compliance, but we've also seen a few pockets of resistance. Some businesses self-identifying with essential businesses, perhaps changing their business model very slightly to try and fit into a different category. And we're at the point now where we're strategizing on some various approaches to force compliance. So it's unfortunate that we have to be in that position, but that's the direction we are moving in some small pockets of the communities. Our deputies have changed their approach in patrol somewhat, and most recently we've asked callers for police services if they'd be interested in clearing their call through a telephone contact. That way we can minimize our deputies' contact with the public, minimize the deputies' potential of exposing somebody that they come in contact with as well. And that seems to be something that's fairly successful and actually appreciated by members of the public. We've traditionally sent a deputy to everyone's home or place of business that calls, and this is something that is sort of a stopgap in this tough time. Our jail system, we continue to make incremental changes to try and protect our inmate population. Our inmate population is still on the decline. That has to do in part with the courts being closed for a lot of business process, in part due to court-ordered remands. Those are people who have sentences to serve being pushed out to a farther date. So that keeps the fresh influx of inmates into our custody low. And also a decline in fresh bookings. We've seen about a 68% decline in bookings. That has to do in part with some changes to our enforcement posture, but also the fact that people are home protecting their properties, that businesses are closed and they're not being victimized by the criminal element. And so we're seeing low crime in the communities as well. It is not because we are releasing prisoners early. I've said that last week, and I'll say it again. That is a strategy that we can employ if we get in a dire situation, and we're ready to do that in the event that does need to be a strategy that we use. We've worked really closely with the public defender, the courts, the district attorney's office on looking at ways to minimize contact in our court system, yet keep our court system moving. So there's some pretty exciting things being done with video conferencing and remote court processes that haven't been done historically, but are allowing the court processes to move forward and minimizing the exposure to contamination to the participants in those processes. So it's a continuous process. We're always looking for ways to continue doing the work and keep our folks safe. Happy to answer any questions that you might have about anything the sheriff's involved with.
Supervisors, do you have any questions? Okay, I did. Because on March 28th, the Judicial Court approved some temporary emergency measures. Will that, holding them a little bit longer, the different processes, is that going to, we'll be able to handle that and make sure that we're good on that, right?
We have been following the Judicial Council's directions very closely, district attorney and courts and public defender in particular, as it impacts them mostly. As far as the impact on our jail system, yes, it's nothing we can't accommodate.
Okay, thank you. And then the public has asked a couple of questions from our office about timeframes of being out. Are there any curfews? Some counties have interacted curfews. We have not. Are there any point where we would?
That I think is a question better suited for the healthcare officer. There is no curfew at this point, but travel is restricted to essential travel. Okay. And at 2 a.m, there's not a whole lot of that. And so we're not seeing the traffic that we typically see when the nightclubs are open and restaurants are open late and such. So, and that goes back to our decrease in bookings. We're just not seeing the activity in the communities that is normal.
Well, wonderful, because a lot of times, from my understanding, is that curfews are because there's so many people out. And if everyone is staying home, then we don't have that issue, and that we don't need to be talking about curfews if that safety is being followed by our community. And I wanted to make sure we touched on that. So thank you.
Sure. And that seems like a drastic measure to me, that if we were to institute something like that, and we're seeing largely a compliant community that wants us to have this virus to have a minimal impact on our public.
Thank you. Thank you.
Supervisors? This is Steve Bennett.
Mm-hmm.
Yeah, I would offer that I'm still seeing quite a few young people going out late in the evening. You know what, that's been the hardest population for us to bring on board on this stay safe at home anyway, but I am still seeing a significant number of young people going out and driving around late in the evening, 11 and 12 o'clock. Thank you.
Thank you very much. And we should be making sure that doesn't happen, or that they're not meeting up. Thank you very much. Appreciate it. Mr. Powers.
Thank you, Sheriff. Next up, we have the director of our Sheriff's Office of Emergency Services, Patrick Maynard, who is coordinating multiple task force for our county.
Good morning, Chair Long and members of the board. Mr. Powers, again, Patrick Maynard, director for the Office of Emergency Services. First and foremost, EOC obviously remains activated still. We've got 30 or so personnel in the EOC every day, just working hard to ensure that PPE is both available and distributed. Again, a great partnership going on with our EMS agency to make that happen. It takes a lot of work. The donations continue to come in, but obtaining those donations requires people to go out and pick them up and coordinate all that stuff. So just a ton of work underway to support those endeavors. Something else that EOC has been doing a lot of lately that I haven't talked a lot about is tracking costs. You can imagine the costs with this are pretty substantial. Fortunately, FEMA is positioned now to cover 75% of our response costs, and I expect in the next week or so we should hear from the state where they'll jump in to cover an additional percentage of those costs, very similar to what we see during a fire. So the good news is there appears to be cost or reimbursement potential for this incident. Of course, we're approaching it as fiscally conservative as possible, but making sure that we have what we need and we're exercising all options as best as we can. Something else I thought was interesting to share, we're talking about some of the different ways we're working to obtain PPE. Recently, we contracted with a company down in LA that's actually producing gowns for us. Typically, they sew shoes, and this company reached out to us, and we received the first shipment yesterday. We're excited to purchase more. We've already purchased more, but we're exercising all options to get that PPE and make it available to first responders. As Mr. Carroll mentioned earlier, masks in that situation have somewhat stabilized for us. We have a pretty good supply here in Ventura County, but we do continue to struggle with things like isolation gowns and face shields. So we're working to bring those things into better stock. Last few weeks, I've presented to your board on the various task forces we have established, and I'd just like to provide you a few brief updates and call up some individuals from other agencies to talk in further detail. The Public Safety Task Force continues to meet on a regular basis. One of the things they recently were able to solidify was what constitutes an exposure to a first responder, and then also what the plan is if that first responder is in fact exposed and needs to self-isolate. Of course, we all have family at home. That poses a difficult challenge. Working with the various HR teams, Sean's team, we've been able to come up with a plan, and the Public Safety Task Force is comfortable with that. Everyone on board is comfortable with that. We almost had to action part of that plan yesterday, but fortunately everything worked out. We didn't have to, but it is in place, and everyone has reached a level of comfort with that. So good news there. The Homeless Task Force, you've obviously heard a lot about the various motels that we've secured around the county. Just yesterday, we opened our first motel out in Thousand Oaks. We're looking to make 75 to 100 beds available at that particular location. And then, of course, in Ventura and Oxnard, we have several beds available as well. Oxnard remains our high-risk location that is populated right now with about 40 individuals that have either been exposed to a positive COVID case or they are positive for COVID. Those numbers are decreasing right now. A lot of those people have been released from that location, so we continue to see those numbers go down. And we're looking today to finally release one of our fully recovered COVID patients back to the community, to a local shelter, actually. So good news there. For further updates on the Homeless Task Force, though, I'd like to invite up Tara Caruth, who will add some additional detail.
Thank you, Patrick. Good morning, Chair Long, members of the board, CEO Powers. I'm Tara Caruth with the County Executive Office and heading up our Homeless Task Force. As of yesterday, at the end of the day, we had 147 high-risk homeless individuals sheltered in these motel programs. We early on established high-risk criteria of 65 and older and people with chronic health conditions. We received word yesterday that aligns with the FEMA and state criteria for reimbursement. So we are continuing to prioritize those rooms for that population. We are working with our county providers and our nonprofit partners, cities, and our law enforcement partners to get these individuals into those motel placements. We have also partnered with our whole person care and public health team to create a hospital discharge protocol to use these motels for homeless patients who may be in the hospital, whether that is COVID related or not, to free up those hospital resources. We are continuing to use the backpack medicine rapid response in the field and encouraging community members, law enforcement partners, city officials, and others to use that. It is posted under on BC Emergency, the flyer and number there, and under the Housing and Homelessness tab. So please use that team to respond so we can respond safely to homeless individuals who may be displaying symptoms. Lastly, I would say homeless services are considered essential services. Our nonprofit providers and our county agencies continue to provide services. They continue to shelter, house people, and provide other basic needs. And that concludes my update. Happy to answer any questions.
Supervisors, do you have any questions? I did have one. In regards to providing space for the critical homeless people in motels. So we are still making sure that they are staying safe in place, or are they able to move about the communities as well?
We have 24-hour security on site. The properties, if you notice them in the community, they are fenced and only have one entrance in and out. We are encouraging those populations who are well but are high risk to shelter in place. Their meals are provided, their services provided. However, if they do have an appointment or a necessary task to conduct, they, like you and I, may leave and come back. But the room is for them and them alone. And then the isolation sites are a little more strict on making sure that those exposed or sick folks stay put and don't expose anyone else.
And that's why the fencing?
The fencing and the security and the staffing.
Okay. So there are tents out in the parking lot on all these different motel areas to make sure that the wraparound services are there. People have not experienced this, no matter what city it's in. So I just wanted to make sure that we're clear as to what it is, and it's a state mandated by the governor to be doing this. And that, how long we did this in a week? Is this?
Yeah,
I mean,
very quickly, thanks to our EOC.
Okay, so I want to make sure that the community knows that this is a very extreme fast turnaround, and to make sure that people know. I appreciated the VC Star covering the article to give some clarity to people in regards to this, and I just wanted to thank you for the explanation, because when you're busy doing all the other thing and then you turn around the corner and you see your motel changed, you're not sure why, and maybe you're not on all the news and stuff. So just some explanations is very important.
To clarify with the tents, one of those tents is a medical tent. So everyone who's coming in is getting medically screened and cleared to be placed into the motel, and the other tent is for social services.
Okay, thank you. Supervisor
Yeah.
Parks, did you have a question?
I do. I also want to thank Tara, doing an incredible job with our most vulnerable populations there. How are homeless individuals transported? Do we have some kind of transportation available so that they can get to the shelter?
We do. Our healthcare agency partners with the Backpack Medicine and Healthcare for the Homeless program, we are using county vehicles that are properly equipped, and the staff wearing the proper equipment to transport those individuals if that's needed.
Thank you. And
Thank
really thank your team for us. Really
I
doing
will.
it amazing.
Thank you so much.
Because how many critical homeless will we be able to house if need be?
I think we have a capacity of between 300 and 350.
Thank you. So that's a small population of our last count, right? Wasn't it 1,700 as our homeless?
It was 1,700. 30% of those people were sheltered in other programs.
Okay.
And then the others were unsheltered. But the number of people that we are sheltering reflects the high risk population, both with whole person care data and our homeless data.
I appreciate that. I think that's an important number to put in our heads when we're talking about that. So, Mr. Powers.
Yeah, as you said, Chair Long, really this is also at the direction of the state guidance, Department of Public Health, saying identify your medically fragile 65 and over, and then get them housed right away. There's good justification for it too, because we've seen in the last few years in San Diego and Los Angeles County, communicable disease spread like wildfire through this population, and that affects the whole community as well. So it's state guidance, but it's also protecting our community. And I do really want to thank Patrick, EOC, and Tara for doing this so quickly. The state was calling them, saying, how did you do this so fast? I'll never say it, but I just wanted you to know that. Thank you.
Agreed. Especially the contracts. I mean, it's not like we've been working on these contracts for months. It was a quick turnaround. So I appreciate that very much.
And that was GSA purchasing who helped facilitate that too. Thank you.
Definite team approach. And yes. Okay. I think we're sterile, maybe. Never assume.
I'll stand over here. Just a couple of things to add in regard to those motels. Obviously, it can be a very challenging client base to deal with, and we have good security in place that is ensuring that any impact to the local neighborhood is minimized. And thus far, I'll knock on wood, we haven't had any issues reported back to us. Obviously, it's a challenge. It's evolving, but it is something we're cognizant on and continue to watch to ensure that we don't impact the area. With the hotels being brought online just yesterday, or the motel rather being brought online yesterday, that'll actually take our room count up to upwards of 500. We are setting a piece of those rooms back as a contingency for placement of any positive patients. So eventually we'll have 400 or so total rooms online available to our homeless population, which will be great. So up next, I'd like to invite up Victoria Jump from the Area Agency on Aging. She's been working along with Melissa Livingston on our Disability Access and Functional Needs Task Force. In particular, Victoria has just been doing a ton of work with feeding folks and a lot of stuff, actually.
Well, while Victoria's coming up, Supervisor Long, could I just make one comment?
Yes, Supervisor Bennett.
Yeah, and I just think it's really great leadership on the homeless side of it, and I think Ventura County can be proud of the effort to have that many places that quickly ready for the at-risk homeless population, because that keeps everybody in the county so much safer. You have 10 infected people walking around. They can really spread a lot of virus out there. So I really appreciate the great work by Tara and everybody else that's gotten this situation under control for us in terms of homeless. So thank you very much.
Thank you, Supervisor. Victoria.
Okay, good morning, members of the board, Chair Long, CEO Powers. I'm Victoria Jump with the Area Agency on Aging. Just to give you a brief update of what we're calling, it's officially been named Quarantine Cuisine. We felt like if we're providing this much food, we should have a name for the program. So Quarantine Cuisine has ramped up, and by the end of today, we'll have made 1,257 deliveries, which equates to 35,000 meals in a week.
What was your average before?
Well, the meal sites did it. As an agency, we were in charge of the logistics behind the scenes, but not an actual meal provider, except for 2 of the sites. So all of this right now is operating out, within the agency, and really it's a huge thanks to GSA and for our disaster service workers, because this would not be possible without them. The most energetic group of people I've ever met, never slowed down, nonstop. Can we do more? I mean, they're constantly, asking what they can do to help, and we've managed to get 2 people from the airports as well who fit right in. And so this is really the efforts of disaster service workers. So we've provided with just our, the 2-week delivery out of the agency, so 35,000 meals. We have an additional 900 people plus growing on a waiting list. We are going to ramp up and do 7-day-a-week production. Right now it's 6 days a week, but we think that by getting more food out, we can keep more people at home, try to keep them safe, avoiding places that they shouldn't be. In case your board does get complaints, we are starting to get rather strict about this. We do tell people, if we're going through all of this effort, you better stay home. So that's part of the screening criteria as well. Our oldest customer now is 103, a woman that lives in Oxnard. We have a lot of 80, 90-year-olds on the program as well. The transit providers have really stepped up. Gold Coast is making a lot of deliveries right now. We're in the process of working with the cities to transition these people onto the regular meal program, which is, a logistical puzzle in order to do it, to make sure that all of the food is there, the volunteers are there, the drivers are there, that they have the freezer and refrigerator storage capacity to make this happen. So this week, the first group of names are going over to the cities. And then, we will focus our efforts on, as an agency, on providing those people that are not on the program. So we'll continue to take people on, and hopefully, as Dr. Levin says, all of these efforts will result in at least slowing the curve and, preventing people who are the most vulnerable and would most likely get it and die from it, keeping them home. So the transit providers are extremely helpful. But that's my update. So if you have any questions.
Supervisors, do you have any questions for Victoria?
Madam Chair, Victoria.
Supervisor Zaragoza.
Yeah, I want to thank you for that young lady. You said it was 103 years old in Oxnard.
Yep.
and numerous 90-year-old individuals that live there. Must be the water that's good over in Oxnard.
That's funny. Well, I really appreciate you updating the website so that people who need food can go there and see where the resources are and the services that are being done is amazing. I asked the 35,000 meals because I know how much you guys are doing that wasn't being done in that capacity before. We had others that were doing that. And so just thank you to GSA and all the team that's really doing it. I mean, it's overwhelming that you're now doing a food service for 7 days a week, that you're going to step that up. That's very important to do. So just thank you for our whole community and also for keeping them home, because I know they don't listen all the time. I have the grandparents, I have the parents that are like, well, I just needed that one thing at the grocery store. I'm just going to go. And to make sure that they stay home, it's imperative. So just thank you. Next up, Melissa.
Good morning, Chair Long, members of the board, Mr. Powers. We continue to work with our home health and hospice group. We did a survey. Through that survey, we were able to understand some common themes that were happening with those providers, most specifically experiencing staffing challenges due to childcare issues that the nurses were having, and we were able to actually share with them our recent essential services childcare listing that was posted on our BC emergency just this week, recognizing that there are essential services for the essential service workers. There is childcare available, so that was like gold to them when they got that. So thank you to our county family for keeping those resources up to date, and to Ashley Batista for keeping that live too. We have decided to do some, expand our call bank that is being supported by many disaster service workers that represent our county family and a number of workers from the Human Service Agency. The call bank is being expanded actually to do some outreach with our home health and hospice providers. We want to get a better picture of what their unmet needs are. Many of them are experiencing challenges with acquiring PPE, knowing how to use that, how to ration that. There's also a lot of fear about actually visiting COVID positive patients. And so we want to do some outreach and education with them on that. A large percentage of those providers are using phone or telehealth as a way to connect with their patients. And so they are trying to connect as they best can. We have also expanded our call center in support of calling all of our vulnerable patients, our clients actually, that we see for the Human Service Agency. We started with our in-home support services. We called all of the 72,000 folks that are on those rolls. I'm not, did I say 72,000? I saw your face. 7,200. Thank you for that.
But it's still remarkable. 7,200.
Well, when we're done, we'll probably make 72,000 calls between the entire population. I'm sorry for that misstatement, but we actually are making an effort to call that entire network. We made 4,200 calls last week, and through those calls, what we're assessing is what are the basic needs, and food is one of those things that's come up over and over again. So we're sharing that information with our social workers who are doing some additional follow-up on those most fragile individuals, as well as sharing that information with Victoria with her focus work on getting the meals out. So we appreciate that partnership. We're also going to be augmenting the VC emergency site for some additional resources for individuals with disabilities. That's an area of the disabilities and access to functional needs population that's important that we reach out to at this time. We also acquired from Direct Relief a large amount of hygiene products that we've provided to AAA so that as they deliver meals, they have the opportunity to inquire with a homebound individual whether they need some of those hygiene products to take them through the period of time that they'll be sheltering in place. We are starting to see an increase in the Human Service Agency's public assistance programs, as might be expected, as people are experiencing loss of employment, unemployment, and for a prolonged period of time, they're starting to reach out. So we'll be watching the impact of that and reporting back to your board as to that impact. And most specifically, our CalFresh applications have increased, and that is our food assistance program, which we would expect to see the biggest spike there. We continue to work with our nonprofits. We're very proud of our partnership with FoodShare and FoodShare's ability to be resilient during these times. As we've heard, they brought in the National Guard. They have already boxed 11,000 boxes ready to be delivered to their pop-up sites that actually start tomorrow. For those areas where pantry shut down, they have 10 pop-up sites that they'll be going out to and distributing those meals. They've also received some financial support through foundation support and Feeding America. And they've made a large procurement. So they're feeling very comfortable about their ability to get food out at this time. We've also mobilized a number of disaster service workers as it relates to looking for opportunities for them to support 211. For them to support FoodShare. We've reached out to United Way with their volunteer group to connect where we can, with the caregivers group is one of those areas also. And thank you to Supervisor Long for being our champion of our Camarillo Farmers Market. We recognized, as we shared, most of those volunteers were older adults and needed to be sheltering at home. And so we are able to carry on another week at the farmers market this Saturday due to your assistance. And thank you for the call out for volunteers. Farmers markets are essential. They are at risk of shutting down if social distancing is not a practice. LA County is looking at shutting down theirs, and we hope to keep ours alive and well if everybody follows the social distancing practices, because fresh fruits and vegetables are very important to our community at this time.
Would I interrupt at this point in time?
Supervisor Bennett?
I just want to make a quick comment about farmers market. I agree completely. Farmers markets are like grocery stores. They're just safer than grocery stores because they're open air instead of enclosed. So I do hope that we can make sure we give all the guidance we can to the farmers markets. I visited 2 farmers markets last week to watch from the outside, and it seemed like people were pretty cautious around each other and stuff. But I do think that if we're going to close farmers markets, we might as well close grocery stores. I mean, they serve the same function, and they actually can be safer being open air. Thank you. Sorry for the interruption, Melissa.
No, absolutely. Thank you, Supervisor Bennett. We also activated, through the approval of our director of EMS, or not EMS, I'm sorry. You know who you are, Patrick.
He has a new job now.
Patrick Maynard approved the activation of VOAD, our volunteer organizations active in disasters. That's an important activation. Once that group is activated, we can mobilize volunteers across the county. That also gave the ability for our long-term recovery group, which is a number of nonprofits that the county family also participates in, to actually be able to begin their case management of individuals who need support, and activation of a case management system that will be shared across the spectrum. So we're very fortunate to have that system coming together. And at the same time, 211 reported last week, we're having a lot of calls. We heard that they're doing better at that. Rigo reported out on some of that. They also brought in 51 volunteers last week that went through training in order to support that need. So we continue to work with them to identify where there's areas they may need additional support. And we're very pleased to be able to support them at this time. They are an important hub for us to keep things running. And in addition to that, now that the long-term recovery group is up, there's an ability to actually begin to provide opportunities for assistance. So this weekend, VCCF's leadership brought together an oversight committee, and that oversight committee It has set up 3 different rapid response funding streams. One of those funding streams is for individuals with families. There'll be an application process. We shared with them our rental assistance program that we did for the Thomas Fire as a way to establish income thresholds and parameters for that program, and they use some of that information to package that program, opening up the applications for those. They're also providing financial assistance to nonprofits that provide important services, most specifically housing, basic needs of housing and feeding and mental health services. They're looking to augment the operating budgets of those nonprofits that may be struggling at this point in time and need to continue to provide those services. And then they are also providing assistance through capital assistance for loans for EDC and for women's economic ventures. So that is the end of my report. I'm happy to answer any questions.
Thank you very much. Supervisors, do you have any questions for Melissa Livingston? I had a couple of questions. Have we ensured, and maybe it's public health as well, that the farmers markets has the rules and regulations to make sure they're 6 feet apart, that there's hand sanitizer, that people aren't combining in clusters? Have we provided that information to make sure?
I can speak only to the Camarillo one because
Okay.
I've been in contact with Dr. Dial from Livingston Memorial, who was very instrumental in running that. And they said that in the last couple weeks, they have they've had masks and gloves and hand sanitizer. They actually requested a hand washing station, actually. And they at last week's the vendors spread out much more than they normally do, and then they had actual people helping with the navigation of social distancing. And so I know at the Camarillo one that they've been practicing that, and I don't know whether, Rigo, you have any further information.
I would just ask to make sure we look into that, to make sure that all the farmer markets that we know, so to keep them updated, because I'd hate to say, hey, you have to close down because you're not doing the steps. I'd rather be proactive like we normally are in educating. So thank you. And then the other question, in the long-term recovery, so if you role play with me a little, I just lost my job. What do I do? I'm going to go file for my unemployment insurance, but I need to feed my kids in April 1st in 2 days, and I have to pay my rent. How do I know what to do besides just lose it?
Well, well, there's obviously different doors by which people can come through the system. Anyone, I mean, we continue, and I know Ashley was talking about the importance of getting out the word of the services we provide and the opportunities, and I think the Human Service Agency is one of those that we need to let people know what services we provide. Many of the people who are impacted by this event aren't aware of our services and have never had to navigate our system. And so getting that word out is important because it's a major portal to support and assistance. The long-term recovery group is a number of nonprofits that have relationships in the community, trusted relationships in the community with people that they serve and see on a regular basis. And through that network, people come in and they actually establish a case. And so then we leverage the entire network of all of those partners that are in that system to assist, whether it be just basic needs, rental assistance, looking for employment, whatever the mental health, emotional health, whatever the need is, you know, there's a triage that goes on. But
Great, and I appreciate the federal declaration in which gave us that case management funding to be able to provide this to our community, because not everyone in Ventura County has ever used that service, only those that were hit with fires. And so making sure that that communication, where would I go for the local assistance center? It's going to be a virtual world versus go to the poinsettia or go to the Camarillo Senior Center or somewhere, you know. So I just want to make sure as we're rolling this out that we can make sure that that's available for everybody. So it's good work going on. Thank you. Mr. Powers?
Just to echo also that the Economic Development Collaborative, EDC, is a great resource for small businesses and their employees for services.
Yes. Thank you for hitting that one. I forgot.
All right, we're on the home stretch here. So up next, we're going to go to Talia Barrera. She's going to be giving an update on the farm worker outreach that's been going on.
Good morning, board members. Chair Long, CEO Powers. My name is Talia Barrera with the Human Services Agency Farm Worker Resource Program. This morning, I will be sharing some information about our outreach efforts within the past couple of weeks. So we've created videos in Spanish and Mixteco of every messages that are being posted on social media. The team has been diligently including all the daily updates in Mixteco so that we can communicate with our farm worker community. The messages are also being done in collaboration with MyCop. They're being done in Purépecha and Zapoteco as well. We're also partnering with different organizations and county agencies. Last week, we recorded a video bilingual in Spanish and Mixteco with the Sheriff's Department, Deputy Cobian, just to share with the community the message and have that comfort level when they see the sheriffs out on the streets. We were invited to participate last Friday on the Spanish COVID-19 on the town hall that was hosted by Assemblymember Irwin and Senator Henry Stern. It was a great experience to share with the community all our outreach efforts as well. We are diligently also working with the growers. We're meeting on a weekly basis, and we're involving our community-based organizations, MyCop, COS, the Farm Bureau, and the local growers who are very concerned about what's happening. We are also including the Ag Commissioner in the conversation because he's been instrumental in helping reach out not only the growers, but also the farm workers. So he's been an amazing partner within the past couple of weeks. We created a flyer, and with the support of the Ag Commissioner, we shared it with 25,000 farm workers. The Ag Commissioner was helpful in sending the message out to the growers. They included the flyer with their paychecks. So obviously we couldn't go wrong with making sure that the farm workers are aware of what's going on. One side, we're trying to do this on a weekly basis. So one side is going to be just providing information on maybe preventive and how to stay healthy, and on the other side is all the resources that we've created. The Facebook account, Spanish, and the group also in Spanish. We've created also information on the Farm Worker Resource Program so they can connect with us if they have any questions, any inquiries. We really want to make the connection with the farm worker community. This week, the flyer has...
Excuse me, I just want to interrupt. That is a remarkable demonstration of the value of the partnership. I mean, to be able to include that in their paychecks where you know they're going to see it, and allows them to regularly get updated information. So my congratulations to you, the growers that participated, the farm workers. That's just a prime example of why this is so valuable. Nice job.
Thank you.
And that comment was Supervisor Bennett, just in case anyone in the audience wanted to know. That was Supervisor Bennett.
Thank you, Supervisor Bennett. We actually we wanted to make it a requirement with the Ag Commissioner, and he said, I can't mandate it, but we highly recommend that they include it in their paycheck. Happy to share with you that a new flyer we created yesterday has gone to print with GSA, and this week we're going to go ahead and print 30,000 flyers so that we can just increase the number of outreach for our farm worker community. The growers are extremely happy that this resource is available because we're also doing it in Spanish and English. So the resources are there to make sure that the community knows what's happening. We're also in the process of creating a farm worker identity card. This is an identifier for the farm workers. It is a small handy dandy tool that they're going to be able to have possibly laminated. It's just during COVID-19, and it will have a serial number. We are going, again, to partner with the Ag Commissioner, and they've been amazing. This is just to ease the fear of being pulled over during a stay-at-home order. We have heard many concerns from the farm worker community, not only the employees, but also the growers, that unfortunately in our neighboring counties, that they're being pulled over without an excuse. And that's why we thought of the idea of partnering with the Sheriff's Department, just sending the message out to the community. You are an essential employee. You are an important part of the economy. We really value your work, and you're okay. We won't pull you over unless you commit an infraction. And that message was sent out both in Spanish and Mixteco. We also Angeles Small, who's providing a lot of support with the Spanish outreach. She was instrumental in getting us an interview with Telemundo last week, and our program, the Farm Worker Resource Program, was featured, and this really created a high volume of calls into our program. It was an excellent report, and they really emphasized the program and how we're reaching the farm worker community in their indigenous languages. And obviously with the contact information, even that same evening, we started receiving a high volume of phone calls. It's amazing to also hear from other counties. I do want to share that UCLA, UC Davis have connected with us. They have received funding for COVID-19, and they're going to be providing support in regards to creating infographics that target the farm worker community, because that's the way we're connecting with them. And so we've been in talks with them because they're going to help us create that information. And we are also establishing another partnership with the California Farm Worker Foundation. They have infographics, they have information, and recently they shared just this last week that they're going to be creating a virtual clinic for farm workers in the state, and they're immediately going to let us know as soon as that's up and active. We are also working on contacting all the over 200 farm workers that have connected with us, and because we created a database, so we have all their phone numbers in our system, and we're calling them, each one of them individually. We are kind of killing a few birds with one stone, because what we're doing is we're making sure that we have their permission to create a WhatsApp group, because that's how we connect with them. To send the messages, either voice messages or videos or print, and that's the best way to connect. So we're contacting them via phone. We're asking them a few questions, including a survey that we had in the works before all this started. And we're asking how they want us to communicate with them. We're asking different questions, just very simple, 4 or 5 questions. How would you like us to communicate with you? WhatsApp, Facebook, television, so that we make sure we understand how to reach the community. And as Chair Long mentioned earlier, the census. We're really emphasizing the fact that regardless of what's happening, we're here to help, but we really need also their support in filling out the census. We've also created a connection and a partnership with the Abundant Table, because we heard that the community was concerned about our farm workers working and then going to the stores and possibly not being able to find just essential food that they needed. So we've created that partnership. The Abundant Table has agreed to work, at least right now, with Ryder, because Ryder alone has over 4,000 employees, and it's community-supported agriculture. So the Abundant Table is going to provide at a very low cost of $10 boxes of produce that the farm worker community uses, and they're willing to the writer at this moment is going to create a list of the farm workers who are interested, and the Abundant Table will be delivering the boxes to each one of the ranches. We're trying to duplicate the same effort with other organizations, including SEAG, and I just connected with the McGraths last week. They're possibly going to be able to share that, because the farmer markets are just seeing a very low volume of sales. So if we can potentially create some good productive boxes of food for the community, they're willing to do it. As a result of everything we've done, flyers, videos, etc., we received a high demand of interest from partners, and obviously, again, UCLA and UC Davis to share in their respective counties. So we've also created a Google shared drive where we're sharing with the community, such as MyCop, Cause, Líderes Campesinas, etc., whoever wants to have access excuse me, to our videos and our material. they're welcome to have access. Obviously, we're a public agency and all that information is public. So if anybody's interested, they're welcome to connect with us. I want to thank Melissa Livingston for the amazing support that she provides just on an ongoing basis. We have seen a very high demand for our services and our resources. And finally, last week, we went to her for help. We asked if we could get a temporary employee just on a temporary basis while this is all going on, and she did not hesitate to approve it immediately. And while we go through the county process, the Ag Commissioner was also extremely supportive. He actually volunteered one of his employees, who's a trilingual Mixteco, who showed up yesterday at our door to help us as well with the outreach and all the work that we're currently having to do with this COVID. We're just seeing a high demand for our program resources and services. I also want to finalize with thanking the growers. The growers have been amazing. We have been connecting with the growers, and they are, most of them, the ones that we know, and some of the largest ones in our county, the ones who would make the impact with our farm worker community, they have been adopting safe practices to keep the farm workers, obviously, in good health and experiencing social distancing. They're reducing their crew sizes. They're alternating their lunch breaks. They're, at least in the strawberry fields and the berry fields, are harvesting. It's being done on every other bed in order to maintain social distancing. And needless to say, they're all very engaged and very willing to help the farm worker community. Just understanding and knowing that they're essential, they're a very important part of our economy and just our community. With that, I'm happy to answer any questions.
Thank you very much. Supervisor Zaragoza, do you have any questions?
Yeah, Madam Chair, I just want to thank Talia, and this Farm Worker Resource Program has become extremely successful. And I'm glad to hear that the working with the growers, and with the Ag Commissioner, and that ID card, I think, is extremely important, working with the sheriffs, because in the past, we've had concerns with the public safety officials stopping those individuals. And so I think it's really, really great that we're working with them. One of the things that I'd like to mention, and I think Talia might have mentioned this, is that I've had people call up and say, why do the farm workers continue to work? They are essential workers like all of us that are here today making policy. And I think it's extremely important that they understand, and people understand, that they are essential workers. I really like the idea of the 200 plus farm workers that you have on your database to convey information to them. And I think that's extremely important that we do that. I'm sure that that's going to increase. And lastly, the partnership that you mentioned between the growers and the farm workers is exactly what we wanted with the Farm Workers Resource Program. So thank you again for Talia and your staff for the excellent work you're doing in Spanish and English, of course, and also in Mixteco. Thank you so much.
Thank you. And any other supervisors on that? I did want to ask about the Mexican consulate, because we've talked about that with their assistance in healthcare services, census, getting out information to critical members. And I wanted to confirm, are we working with them as well?
We're working with them as much as we possibly can. They're currently closed, and so with the connections, I work directly with the consul, and just with the resources that are posted and that they can share with us, we're sharing them. But unfortunately, because they're closed, we're just trying to dig as much information as we possibly can to share with the community with the resources that are posted. But yes, that is definitely one of our high priorities.
Thank you, and I wanted people to know that as well.
Absolutely.
Thank you. Mr. Powers.
Thank you, Chair Long. Thank you for the wonderful report, Talia. I want to just let your board know, too, that something that your board has invested in and supported is our community liaison effort through our office, led by Rosa Gonzalez, and that has been instrumental as forming a foundation for this project. So as your board's innovative Farm Worker Resource Program was developed and implemented, because of the connections that Rosa had made in the community, instantly the Farm Worker Resources Program was connected to all those resources and community-based organizations. And I think it really accelerated its reach into the community, and we're seeing the benefit of that in this crisis that we have right now.
Absolutely. We actually see her as a part of our team already. So thank you for allowing us to have that connection with Rosa, because she is amazing. The team's amazing. Fatima, Jael, they're just obviously great connectors in the community. And yeah, but Rosa, we just consider her part of our team.
Yes, having those community liaison has just been essential. I've seen her work magic. So just thank you for everybody and what you're doing. So thanks.
This is Steve Bennett.
Yes, Supervisor Bennett.
I don't remember voting on moving Rosa into that pay category.
Very good call. Emergency.
We knew that you would. That's the thing.
Thank you. Thank you. Patrick.
All right, a couple of additional updates. Our education task force being headed up by Dave Shermer of Ventura County Office of Education. He reports all 20 Ventura County schools remain closed. We know that. They are hopeful that they may potentially be able to reopen on May 1st. Again, that's depending on where we are with this, but they are poised and ready to return if the situation is, of course, stable and appropriate. Schools have, a lot of them have implemented their distance learning programs. They're using iPads, tablets, all that good stuff to work through those. In some cases where they don't have those devices, they are using paper materials sharing. So good to know there. All that information, of course, can be found at vcoe.org. In terms of higher education, they've all, of course, transitioned to both distance learning or all distance learning at this point. Some of the employees are also working remotely in those cases as well. Business task force headed up by Mr. Paul Stamper. Something really significant to share here, and again, this is alarming, but I think this is the reality of the situation in which we're dealing with. Currently, initial estimates anticipate an unemployment rate of up to 22% in Ventura County in April, and that's up from 3.7%. That's significant, and again, that's a forecast, but given where we are with things, I think we can all appreciate the gravity of the situation and where we are today. So I think that's important to mention. Of course, the CARES Act was signed March 27th. That will provide a ton of money to small businesses and non-governmental organizations out there through the Small Business Administration. Information for businesses that need that assistance is available on our website, as well as a ton of other resources. Again, vcemergency.com, where you can pick that up. And then lastly, before I turn it over to Ashley, I just want to throw out a couple of thank yous I think are really important. If you haven't been by any of our shelter sites, we invite you to come by and check out the work. There's just been some tremendous leadership going on, and I'd be remiss if I didn't thank a few people. So Chris Russell, Anna Sanchez, Jill Fleming, James Boyd, Deanna Handel, Eva Reeder, Mr. Stephen Carnazes, and all the faith-based organizations that have stepped up. Stephen is actually volunteering his time to help manage the Oxnard location. A ton of work, takes a ton of leadership to really make these things happen. We know this is a challenging demographic to manage, and they're out there all day, every day, despite the dangerous conditions in some cases, to help us out as a county and just really doing great work. So I'm grateful for their effort, and I thank them. So with that, Ashley.
Thank you, Patrick. As Ashley's coming down, I just wanted to reflect back on what Patrick was talking about, that unemployment percentage. It is staggering, and that's not projected in, I mean, that's happening right now. And so that's why the recovery efforts that we have need to happen right now. So.
And then also just to hit on with the schools, they are continuing to feed our children, and that's very important, that we're trying to keep them learning and also fed. There was information out just on LA County about 44,000 students not signing in to get their schooling, and so it's really imperative that we're working with our families to make sure they're getting the food, the education, and so forth to help them out. So thank you. Ashley.
Yeah, and in addition to school, we've also been passing out flyers. So school districts are passing out the flyers with the lunches and giving that information to families as well. So today I'm going to be going over some of our stats in terms of our reach for social media. We're going to start out with our Facebook page. It's important to mention the stats just so that our board understands the reach as we are sharing this critical information. We are, of course, using our traditional platforms of radio. This morning there were 3 interviews in Spanish on the local radio. We also had 2 interviews in English, as well as our district attorney was on KBTA talking about price gouging. So we've definitely been hitting our platforms in radio as well as the news, but today we're going to focus on our social media. So our Facebook page is at County of Ventura. From March 24th to March 30th, our post reach, this means the number of people who have viewed our post, was 725,750 people. Our post engagement, meaning the analytics of Facebook tell us how many people have gone back to read our posts again, there were 412,354 people who actually reacted to the post. A reaction means they either shared it, they left a comment, or they left a smiley face or a like on the post. We also have, for example, just some of our reach. The message from the doctors that was posted over the weekend, it was viewed 248,918 times. 59,440 people clicked on it more than once. There were 12,302 reactions. That means that people left comments or gave other shares or likes to the post. We have also streamed our board meetings. This meeting right now is being streamed on Facebook as well as Twitter. When it was streamed on 3/17, it had 46,000 views on our Facebook page. It had 23,900 views on our group page for a total of 69,900 views. That is pretty remarkable that many folks are tuning in to get updates on this COVID-19 crisis. Our Facebook group page was launched on March 16th. The group page offers an opportunity for residents to post questions. It's more interactive than a traditional Facebook page. Since the Facebook group launched, we have 38,968 members. A group page, you have to ask to become a member of the page. It's not like a public Facebook page where you can like or just simply visit to check out the posts. We have 165,100 posts on that page from our community members. This is questions, comments, people wanting more information. We also launched a Spanish-only Facebook page and Facebook group. From March 24th to March 30th, we have 138,929 people who have reached or clicked on the page. The videos, which is really important, especially for our Mixteco speakers. It is not a written language, so it's really important that we're providing video on that platform. The videos have been viewed 45,766 times on the Spanish platforms. We also have Nextdoor.com. Nextdoor.com is a private social network. Residents have to confirm who they are and where they live to join Nextdoor. We have 200,098 County of Ventura residents on the Nextdoor platform. For those on Nextdoor who aren't seeing our posts, you can simply search County of Ventura and you would get a daily update in your email box. For the messages from the doctors, it was clicked on 58,732 times, had 629 comments and 500 reactions on the Nextdoor platform. We are also on Twitter. It is pretty remarkable to report that we have had 2.2 million tweet impressions. That's the number of views to our posts over the past 28 days. Our handle is County of Ventura. I encourage you to watch our updates on there. We are currently, as I mentioned, streaming live this meeting. The profile, it has been viewed 74,300 times. We have a little over 4,000 new followers on that platform. Instagram, small but mighty, it's growing. We have a little over 2,000 views over the past, 10,000 views over the past 7 days on that platform. So we are trying to reach all of our social media platforms in addition to updates at VC Emergency. Right now there are both the unincorporated as well as incorporated areas of our city listed on there. I know that was mentioned earlier in the meeting. I encourage our community members to check out the stats at vcemergency.com. And today we will be launching a live press conference with KEYT. It will be a daily effort so our community members can get updates on the news, especially those homebound seniors who may not be on social media or tuning in on the radio. They will be seeing an update on the news. We also have all of our videos that we've been creating with CAPS Media is on public TV and shared with other public television providers throughout the county. So folks can tune in there. Information is on VC Emergency, as well as our videos are on VC Emergency too. So thank you.
So just to get your head around all of that, the reason why in my board comments I had talked about how we're reaching out to people, this is amazing. If anyone has any social media account, just one of them, just to answer people or to get back or to make sure that information is accurate, you don't have a spelling error, that's hard enough. to see the amazing work that is being done to get up-to-date information I appreciate it. And I want to say thank you because it's a lot of work. And I appreciate listening to our community. We don't all get the same information at the same place. We don't just all order VC Star and that's where all our news is. We don't just listen to the radio or, we're 24/7 type of people and we get our news in different ways. And I really do appreciate it because I think that has radiated more of a calm than a panic. And I think that that is very important when we're talking about this pandemic, is to understand and make sure the information is accurate as best we possibly can and informational so that we can make sure people understand what the crucial issues, so we can continue to be a type of county and keep people at home safe and well. And I really appreciate yourself and your team in doing this, definitely. Supervisors, do you have any questions or comments you'd like to state?
This is Steve Bennett. I have
Supervisor
a comment.
Bennett.
I just would like to, in the middle of all of the rush, let Ashley know how much and I know I've heard it from so many of us at our level, appreciate her arrival just in the nick of time to get us to be so active on social media at this critical time. So Ashley, thank you very much for your professionalism and your experience and stuff. This has been a great comfort to the citizens of Ventura County to have all of this communication. Thank you.
Thank you so much. I really appreciate that. It's really an honor to be helpful during this time. And I just really want to give a shout out to the team behind the scenes that's working hard, especially to provide that information in Spanish. I also want to give a shout out to the county employees who have been so gracious to take their time to do interviews and videos at a time when their focus is on other things. They've really made it a priority to make sure that we're providing community members with the information they need and more.
Yes, and the Supervisor Parks.
Yes, I also, it is amazing what you're doing, Ashley. I'm glad you have a team. I think of you answering all those emails and tweets and all that, but it is wonderful, not only that, but also helping us with our constituents too, who are looking for information. And it's a moving target. We have to continually update and change. So it's just really important to have that transparency. People will trust government more if they see that we are providing that information, and we are doing an incredible job for us. And welcome aboard. You just started. One of the things that I had mentioned earlier in my board comments was the physician's letter, and I know they do provide a pretty extreme number there, that if we don't do social distancing, we'll need 18,000 ventilators, whereas if we do that good social distancing, we will be able to extend the peak instead of like 58 days to now 170 days, and then only need they're saying 475 ventilators, where currently we only have about 180. But just that issue, I know, has certainly, as you point out in your numbers, raised a lot of interest on social media, and I'm wondering if you have any thoughts on that.
Yeah, I appreciate that. The three doctors that helped draft the letter have also been providing interviews in the news as well as the print media. It's important to note that in that letter, it's really urging our community members to stay home to stop the spread. And if community members continue to not social distance in certain areas, that is the extreme of what could occur. So it's important to mention that we have actually seen community members following Dr. Levin's orders, and we have seen businesses closing and really taking this to heart. And so that letter is an example of how things can get so extreme if things are not followed.
And also thank you coordinating the PIOs of the different departments and with the different cities to make sure that we're saying the same message. I know with OES that has been a consistent message for the last 4 years or 3 years with our emergencies, and just being consistent with that is really important. It ends the questions, or it limits the questions as much as we can. So I really do appreciate that. and getting everyone out. You're not going to just hear from the Board of Supervisors. You're going to hear from people that are feet on the ground, making different every day. Supervisor Zaragoza.
Yeah, Madam Chair, I want to also thank Ashley and Rose. I'm going to mention some of the other folks that when I see them too, as Ashley, Rosa, Natalie, and Lori and Brendan and Monica, and the sales office for all the work they do. You know, my office is right close to their office. When I go by there, they're really working, you know, and doing a lot of good work on social media. When you're talking thousands and thousands of responses, that's just absolutely fantastic. So thank you so much, Ashley, for the good work.
Thank you.
Mr. Powers.
Yeah, thank you. Just a couple things real quick. I think it's pretty nice that we actually have a handle now at the county. Who knew? Also wanted to mention that in addition to all this work that we just touched on, you know, the team and Ashley and everybody's regularly communicating and connecting with the STAR, the Acorn, radio, English and Spanish, our new partnership with KEYT, which we're very excited about. But also to mention the team. So one of the things that Ashley does in the Joint Information Center with the EOC and coordinating all of the good work that they do is work with the subject matter experts. So like the public health leadership, the physicians from our system, Patrick at OES, County Council, making sure that the data that we're communicating, they ask good, tough questions, the community does. And we want to make sure we get that information and everybody is contributing to that and it's getting back to the community. So there's a lot of good thoughts and efforts to go into that. So thank you.
Thank you.
Thank you very much. And Patrick, congratulations on the director's title.
And last and most certainly not least, our HR Director, Sean Otten, to touch on the latest happenings with our county workforce. Thanks, Sean.
Thank you. It's a pleasure being up here. Thank you, Chair Long, members of the board, Mr. Powers. I'm Sean Otten, your Human Resources Director, and I'd be remiss if I did not reiterate some of the comments that have been made to recognize the service of our county employees during these incredibly difficult times. For my part, and I think all of us see this, they're quietly, stoically going through their business, serving the public in their capacity as disaster service workers. I think above and beyond the call of duty. I mean, I think most of our workforce have been called to do different things than what they have in these critical times. So I want to put out there as a recognition also to reiterate some of your comments. So our job as as your county human resources division, is really to function simply as a solution finder. Our main task in these last few weeks has been to source employees, reassign them to the most critical of needs by way of for example, I know that at the healthcare agency, we've reassigned many of the employees to more critical functions that are needed at this point. For the AAA and the Human Services Agency, I think we've had 60 or so employees who've I think Victoria Jump mentioned the General Service Agency's employees who are now delivering food for her group. So I think it's an amazing time, and by the end of this, I think we'll be much closer, because we've had to be much closer and more highly functioning than we even are right now. So some of the other things we've been working on is, of course, we've been partnering with OES and EMS to enhance. In the next few days, we'll enhance some of the screenings at our high pedestrian buildings, the buildings that see the most flow in. We're going to put in place temperature readings. Some of our agencies are already doing that. I know that fire and I think probation and the hospital are already screening employees and members of the public that are coming in those buildings, but we'll focus on some of the other buildings and screen for symptomatic temperatures, 100, 100.4. We'll work with Dr. Cho or Dr. Fankhauser to get some training on that. And in the next few days, you'll see deployment in those bigger buildings. We've also in the last week worked with our labor partners. I had some good feedback from supervisors and our CEO, and we've implemented procedures that for primarily first responders, frontline employees, healthcare agency workers who either become symptomatic or who, after coming into contact with a client or a patient who may likely need testing. So we've worked on quarantine and testing procedures for those employees. It might impact anyone within the county, but really we think it's those frontline employees that we need to have some processes in place in case of that eventuality, which we hope really doesn't come to pass, but unfortunately it does look like it will. Finally, you may have noticed we've accelerated our communications to all employees. We almost every day we send a number of emails that are either to agency heads or all employees. Yesterday, I was pleased to be able to have our EAP director send a message to all employees. EAP is also in the act. They have video sessions that are available and that can be appointments can be made for. Also, childcare. I was pleasantly surprised. Our work-life program manager identified childcare options that meet our local public health order that are very specific. But for employees performing essential functions, there are some childcare options that they may want to look at. Lastly, we're very aware of there's just a flood of new regulatory developments and orders coming from the state. For example, the California Health Corporation, anyway, we're very aware of these regulatory requirements or developments, and we're really keeping an eye on how we as a county can take advantage of that. Just, I think, an hour or so ago, we sent a guidance to department heads about rehiring of retirees, where we don't need to wait for the 6 month, and we're no longer limited to the 960 hours that a retiree can work within a fiscal year. So these are tools that we're informing our partners and stakeholders about, that they can take advantage of and kind of facilitate hiring. So that being said, I'm happy to take any questions that you may have, and know that we're there for our partners.
Mr. Powers, did you want to make a comment?
Thank you. Yeah, thank you, Mr. Otten, for that report, and you just echo your comments about the commitment of our county employees. This is a calling for them. They're mission driven. We see it in our healthcare providers willing to take risks for us, our first responders, sheriff, fire, probation, social workers going out to help our homebound seniors, and the reassigned employees. I think you reported to me the other day, Sean, there's like 60 folks, 60 employees from other agencies who are now helping Human Services Agency and Area Agency on Agency with a good attitude and trying to just pitch in and do whatever it takes. So just do appreciate your work and HR's work and all the county employees. Thank you.
Thank you. Supervisors, do you have any questions? Okay, I did want to ask, we heard from our public health director, Dr. Levin, 3 to 7 weeks. And as a strain on a private company versus a public company, when you're managing our employees from home, I appreciate that you're going to be working with our managers and our directors to handle that, because workforce flow and everything else that's going on. I was on a call with SCE, and we're talking about how do we do Zoom meetings from home when you got the kids and the dogs and everyone gone behind and you're stressed with all this other stuff, and making sure that our management is supported. Because I know that, evaluations will be coming and all these different things there, and just to make sure that we're mindset to support our employees. And I really appreciate that. I have some friends that are HRs for private companies and so forth, and it's a huge task to get our employees to be working from home. Merrill Lynch, what was it, 20,000 employees were working from home. I mean, there's just an amazing amount. And then you talk about electricity and toilet paper and all the other things that are going on. So I just appreciate the effort that you and your staff are doing. And with the first responders, thank you very much. I think it's a very proactive effect because we will see a surge. So I appreciate it.
Thank you for your board support. I know the action of last week was very, very much appreciated by many people. So thank you. We're all grateful to be working here at the county.
Well, as one thing is we have to watch every day for new rules and regulations that are coming down from the state, and to be nimble with that, to be supportive for our staffing and how we can move things around is really important. So thank you.
Great, thank you.
Mr. Powers.
I'll just close real quick. Thank you, Sean. And thank you, board, for the time this morning. So that's a lot of moving parts, as you can tell. Just a note on that is that that's actually a summary of the work that's going on. So just to give you a sense of the magnitude. And the other piece is you've heard some of our leaders here today, recognize other people. And I want you to know where that comes from, in my humble estimation, is because despite their strong leadership, they're not comfortable taking the credit for it. They want your board and the community to know all the work that's going on behind the scenes that you don't get to see. That's why they do it. And I think that speaks to fostering the culture that we have of truly working together, all in one direction. So just thank you very much.
Well, we do have 2 public comments. So I would like to make sure we hear those. Lori, would you like to read those for us, please?
Yes. From Kathy Spear. She says, regarding big box stores and markets, many of us have been questioning why farmers markets remain open. I emailed Ojai City Manager James Vega on March 28th and questioned why Ojai's farmers market was remaining open, since shoppers are not 6 feet away, and a farmer's market is often a social atmosphere with people lingering. Here is a copy and paste of his response. He says, only the essential service, i.e. food, the state has declared that essential, similar to a grocery store.
Kathy, thank you very much for your comments. And the next one, Carolyn Bowderman.
The only thing I will say to that, and appreciate that public comment, is we do have every morning call with the city managers, so happy to loop back with the city manager from Ojai and just some public health support in terms of social distancing guidelines that we're seeing at other farmers markets throughout the county.
Thank you.
And the next one is Carolyn Bowderman. Of the 2,213 tested in Ventura County, were there 2,000 plus negatives, or are you still awaiting a majority of those results? Thanks for keeping us informed and updated.
And I checked with Rico Vargas, our public health director, and they are not pending. Those are actual results. So other than the 126 positive, all the other over 2,000 reports are negative. Thank you for the question.
Thank you for the clarification. And thank you to the public. I know this process is new. We now email our public comments in due to the fact that the government center is closed to public. So appreciate that. We will, as the public is watching, we'll have another meeting next week, Tuesday at 8:30. And the agenda will be screened and you can provide your comments as well. So I appreciate the public comments on this item. This is a receive report, so there is no motion. But thank you to the work, 2.5 hours of discussion on COVID-19. If we were doing this every day, I would be very concerned that we weren't getting the essence of the COVID-19 stopped. So I appreciate all the time and effort and the updates. I know there's a lot of conference calls that go on outside of the public eye, and just thank you very much. So we'll move on if there's no other comments from supervisors.
This is Supervisor Huber.
Supervisor Huber.
Thank you for the excellent work up on this. It's very, very informative. Thank you. Appreciate the hard work.
Thank you. Anyone else? Okay, moving on to item number 9. Our public hearing regarding the adoption of the urgency ordinance for temporary prohibiting of suspending evictions in the unincorporated areas of Ventura County and determining the exemptions from the California Environment Quality Act.
Good morning, Chair Long, members of the board, CEO Powers. For the record, Mike Pettit with the County Executive Office. This item before your board is for consideration is the adoption of an urgency ordinance temporarily suspending or prohibiting evictions in the unincorporated area of Ventura County. Based upon the guidance received from your board at your last meeting, the proposed ordinance sets forth various restrictions on evictions throughout the unincorporated area of the county, and works to acknowledge the points that that your board made at its last meeting. Specifically, the urgency ordinance before you provides eviction protections for both residential and commercial tenants through May 31st, 2020. This is in accordance with the governor's orders. And that protection is related to non-payment of rent due to demonstrated impacts from COVID-19. The ordinance also outlines some of the examples of those demonstrated impacts, but also leaves room for impacts not conceived in those examples, and also leaves room for further provisions made by the state or federal or even locally of response items to COVID-19 that may impact individuals financially in a direct way. It also provides a 30-day notification period from the date that rent is due, irrespective of grace periods in contracts, for tenants to notify landlords in writing of the COVID-19 related hardships. It also encourages tenants to notify their landlords of an inability to pay on or before the date that rent is due. And it provides examples, as mentioned, of the types of documentation that are to be submitted as proof of COVID-19 hardship. It encourages tenants to make partial payments of rent where possible. It does not relieve tenants of their liability for unpaid rent. And it identifies penalties for landlords or tenants who violate any part of the ordinance. And with that, I'll entertain any questions that the board might have.
Thank you. And the governor's ordinance came out on Friday, I believe, so that was very helpful. And then we're extending it also to a commercial.
That's correct.
His was just the residential side of it. I will open the public hearing. Are there any public comments? There's not been any public comments that have been emailed to us. So I will close the public comment period. And supervisors, do you have any further questions, comments?
I have one question, Steve Bennett.
Supervisor Bennett?
Thank you. Mike, I know I spoke with you yesterday and Mr. Powers, and the answer was that we still have to do this outside of the fact that it covers commercial leases, which the governor's order did not, but just for the residential side of it. But I keep reading things that says the governor's order was an order. It didn't require local implementation. I'm fine with this. I support our local implementation, but when I read the order, I don't see anything that says, if implemented by locals or that this allows locals to do it. I read it as this is now the law of the state of California. Can you help me with the interpretation that I got yesterday from, I believe, County Council through you, was that, no, we still have to do this. Can you explain why we still have to, why that's the case? I just want to make sure I understand the difference between the two orders.
County Council, if you want to explain that one.
Sure. The governor's order that was issued on Friday, when you look at it, what it actually does is it extends the unlawful detainer proceeding. Unlawful detainer is the legal phrase used for evictions. In the typical eviction unlawful detainer action, it's an accelerated court process. It's one of the most accelerated civil proceedings we have. And once a landlord files an unlawful detainer lawsuit, the tenant has just 5 days to file a response. In most civil actions, it's 30 days. What the governor's order did on Friday was extend that 5-day period by 60 days to a total of 65 days. That's what it does. So it really doesn't stop any unlawful detainer process. It just gives tenants 60 more days to deal with it. So it provides really limited protection. What the proposed ordinance here before your board does is actually stops the eviction process. It will give tenants more time to come up with the money that they don't have now to be able to pay the rent when the emergency lifts and the governor's order expires.
Supervisor Bennett, do you have any other questions on that?
No, thank you very much.
Thank you. And I would agree. The governor has suggested and have implemented a lot of items in regards to the COVID-19. with the thought of local control. So making sure that the rules and regulations that are put for the counties are specific for the rules and regulations of the county. So even though there's an overall umbrella, we still have an ordinance that is based for our county and very clear, just like our stay-at-home ordinance, clear for our community what is acceptable and what is not acceptable. So I appreciate the county council looking into this and the CEO's office. You are turning this around in a week. I'd like to state that as well. Very quick, and appreciate the quickness on this.
I think it really, county council has been, as you can imagine, fielding many questions right now, and they've been amazing in turning these things around. And it really speaks to the leadership of our CEO. As you know, he works 24/7. I don't know where he gets his energy from. I think if we could bottle that, we could cure COVID right now. But it really is a testimony to all the work going on, as has been mentioned across the county. So many people working so many hours to make sure that these important services and protections are put into place.
Right. And I also want to talk, just state thank you to our state associations and our lobbyists as well for making sure the governor understands the issues that are pertinent to our community. That was quickly done. So I just want to say thank you to them as well. With this, if
Supervisor Huber.
Supervisor Huber, hi.
Yes, thank you. I want to thank Mike Pettit and the county staff that worked hard on this urgency ordinance. At the last board meeting, I announced support for this effort, but identified some concerns. You have covered and addressed each of these concerns. Thank you very much. I urge support for this reasonable and compassionate urgency ordinance. Thank you.
Thank you very much, Supervisor Huber. With that, if there's no further questions, concerns, Supervisor Parks?
I would also like to thank staff for the quick movement on this. It's really vital. And also that it includes commercial evictions too. I think we really have to consider our business community here as well as residential.
Thank you. Good point. Okay, with that, I would like to ask for a motion to approve.
Moved.
I think that is Supervisor Huber.
Yes.
Great. A motion. Can I get a second?
Second from Parks.
Supervisor Parks has seconded that. Thank you very much. If there's no further questions, we're going to do a roll call vote.
First, I'm going to read the title into the record, please.
Thank you.
This is an urgency ordinance of the County of Ventura temporarily prohibiting or suspending residential and commercial evictions within the unincorporated area of Ventura County for non-payment of rent based on substantial financial hardship caused by the COVID-19 pandemic. Supervisor Bennett.
Yes.
Supervisor Parks.
Yes.
Supervisor Huber.
Yes.
Supervisor Zaragoza. Supervisor Zaragoza.
Yes.
Thank you. Supervisor Long.
Yes. So that is unanimous that the motion has been passed. Thank you very much. Appreciate it. Moving to number 10 is our ratification of the CEO's execution of grant agreements. Hello.
Good morning, Chair Long, board members. I am here before you to ask for your ratification to accept grant agreements from the state. This is part of SB 89 the governor signed on March 17th, providing $100 million to all counties, split between all counties, continuums of care, and the 13 largest cities. This will give the Ventura County Continuum of Care $325,257 and the county $299,245 for a combined award of $624,503 to fill critical gaps in providing homeless services in response to COVID-19. We're asking for your approval for regional collaboration between the Continuum of Care and county as we look to work with our EOC and determine what will not be reimbursable by FEMA and where to best use these resources. The funding use, as the state has developed, is intentionally broad to help us be flexible in meeting local needs, and it must be fully encumbered by June 30th of 2020. So we received these awards last week on Monday, the grant agreements, and have worked with County Council to move this item before you as quickly as possible. Happy to answer any questions.
That is amazing. The Department of Finance wrote a check that quick. I just think about that with government, how things don't usually move that fast and how quickly we were able to get the resources. So I just appreciate the state's efforts and our legislation to make sure that we get that done. Supervisors, do you have any questions?
I would just echo your comments, Chair Long. The state has been amazing. The governor has really stepped up, and I'm so pleased to be living in the state of California.
I would agree. And in the county of Ventura, it's very, very special. So thank you, Supervisor Parks. With that, if I could get a motion to approve this item.
So moves, Zaragoza.
Thank you.
Second, Huber.
Supervisor Zaragoza first. Supervisor Huber was a second. Any further discussion? We will have a roll call. Thank you. Lori?
I'm waiting for the computer here. Supervisor Bennett?
Yes.
Supervisor Parks?
Yes.
Supervisor Huber?
Yes.
Supervisor Zaragoza?
Yes.
Supervisor Long?
Yes. So that motion is approved unanimously. Please go do the good work that you do.
Thank you so much.
Appreciate it. Next item is our authorization of the CEO to waive the board policy prohibiting certain contract provisions. Mr. Powers, would you like to take this one?
Yes, thank you, Chair Long, board members. This is sort of a companion to last week's delegated authority and requesting that your board authorize our office to waive the policies in the admin manual prohibiting the inclusion of interest provisions, attorney fee provisions, and certain governing law and venue provisions in county contracts when necessary in the exercise of the contracting authority delegated to our office by your boards last week and this week. And just to be clear about that too, I will consult very closely with County Council as well as our auditor controller, and we will use this sparingly, I can assure you. But when push comes to shove, and it's something that we really need, so thank you for considering it.
Appreciate that. Supervisors, do you have any questions? Thank you.
I appreciate how it is written, really clear and specific. One of the commissions that I'm on is looking at doing the same, but just made it so broad, it brought concern. But when you stipulate it this clearly, it is easy to support and certainly understandable why we need this. So definitely support it. I'll be happy to move the motion.
Thank you very much. Supervisor Parks did the first, and it sounded like Supervisor Huber was the second on this. So great, thank you very much. And any further discussions on this? If we can get a roll call.
Supervisor Bennett?
Yes. Yes.
Supervisor Parks?
Yes.
Supervisor Huber, sorry.
Yes.
Supervisor Zaragoza?
Yes.
Supervisor Long?
Yes. So that motion has been used and made unanimously. So thank you very much. Next item is our healthcare agency. With the approval of authorization for the purchasing agent to sign master healthcare staffing agreement. Mr. Foley, welcome.
Good morning.
Morning.
Chair Long, supervisors, Mr. Powers. Bill Foley, director of the healthcare agency. It goes without saying, and it has been expressed a few times this morning, that we recognize the dedication, hard work, bravery of our health system staff at our hospitals, our clinics, out in the field, in the county, who put themselves truly in harm's way to fight this virus and this illness. But as we plan for the surge at the hospitals, we're going to need reinforcements. And this request is for approval to sign a master healthcare staffing agreement with Huffmaster Crisis Response and Huffmaster Healthcare Staffing for temporary emergency staffing services, and approval to expend up to $2.4 million under this agreement.
I'm sorry, if you could mute your phone. Thank you. Sorry, Mr. Foley.
We have already been in discussions with Huffmaster about an initial request for 20 nurses, 15 ICU nurses and 5 emergency room nurses, recognizing that they won't be able to produce all 20 immediately, but we want to really work closely with them to get the staffing in as quickly as possible. As Dr. Fankhauser had reported earlier, we're planning to expand our surge capacity to up to 80 additional beds. So this staffing will be critical as we expand and as we expect to surge with more ICU and ventilator patients. Thank you.
Thank you. I would like to say thank you very much, the outreach to the Blue Ribbon Committee to ensure that our community understands what's going on at VCMC, but also Santa Paula Hospital, and the staffing that goes along with that, and the crucial decisions that all of you have to make in regards to making sure our community is safe. So I appreciate the transparency and the outreach very much so. Are the supervisors, do you have any questions? I think that is a good thing that you're not hearing from us. It's more like, hey, we got to get this done right away.
Definitely support it.
Supervisor Parks?
I definitely support it. Move the item, and thank you for bringing it forward.
Thank you. We have a first by Supervisor Parks. Can I get a second?
Second, Zaragoza.
Thank you. Supervisor Zaragoza seconded. Any further questions? If not, we'll do a roll call.
Supervisor Bennett?
Yes.
Supervisor Parks?
Yes.
Supervisor Huber?
Yes.
Supervisor Zaragoza?
Yes.
Supervisor Long?
Yes, the motion has been passed unanimously. Thank you very much. Next item is the authorization of the Healthcare Agency Director to waive sliding fee discount payments.
Yes, request to waive the sliding fee discount payment program and self-pay discount program patient care costs for office visits due to respiratory or COVID-19 related symptoms. We are really very committed to encouraging that all of our patients receive access to COVID-19 screening and testing without regard to their ability to pay. We understand that for our most vulnerable patient population, sliding fee discount payment program and self-pay discount program costs could be a barrier to care. We're really encouraging our patients to seek this testing. Accordingly, we're requesting approval to waive the sliding fee discount payment program.
Thank you. And with that, I understand the governor has stated that some of the cost associated with testing for COVID-19 would be paid by the state or not paid by the patient. So we'll be making sure we track that.
Yes,
the healthcare providers so that we're billing appropriately.
Yes.
Great. Supervisors, do you have any questions? Mr. Powers?
I just want to make sure I mention, I'm not sure it has been, that this item received a letter of support from MyCop. That we're very supportive of this item and the farm worker community in particular.
Thank you very much.
I move the recommended action.
Thank you.
Second.
Supervisor Bennett has moved it. Supervisor Zaragoza has made a second. Is there any further discussions? Let's have a roll call, Lori. Thank you.
Supervisor Bennett,
Yes.
Supervisor Parks,
Yes.
Supervisor Huber,
Yes.
Supervisor Zaragoza,
Yes.
Supervisor Long.
Yes. Thank you very much. That motion has been approved unanimously. Thank you without that. Did
Thank you.
we have any other comment that needed to be made from the CEOs on the agenda?
Thank you, Chair Long.
Yes.
Board members, wanted to go back to item 8. Appreciate County Council's guidance on that. Just to give you an update that from the county's Environmental Health Department, Charles Ginkle, just wanted us to know that the Environmental Health Department is working closely with the farmers markets, but also our local grocery store chains, providing the social distancing guidance and following up with them. So that is actively happening for our Environmental Health Department. Thank you.
Thank you very much. And as we come to a close, I urge everyone to go to vcemergency.com to get the latest information. We will be getting out our testing data and our cases every day, usually in the late afternoon. And then also all the media support. Please make sure that you're on our social media, you're listing the paper, and most importantly, you're staying home and being well and keeping everyone home. Excuse me, Supervisor Huber, was that you?
Yeah.
Or Supervisor
Parks.
Parks? Sorry. Yes, please.
But close. I just wanted to support what Supervisor Bennett had said earlier in his board comments regarding the grocery stores. They are a magnet for people coming together, and with that we know the potential for spread of coronavirus. So I'm glad that our Environmental Health Department is being strong and advocating. But I also support his suggestion and our CEO's consideration of having county employees to help those stores to manage by being present and doing all that we can. There seems like there could be better processes for getting groceries than what we have right now, and anything we can do, because that to me is the one kind of loose link we have in our safety for our residents, because we all need to get food, and that's how most of us do it. So all we can do to tighten that aspect, I think, will go a long way towards avoiding the spread. So thank you.
Thank you very much.
Supervisor Long?
Bennett? Mm-hmm.
Yeah. Let me get my, there we go. I appreciate Supervisor Parks' comments there. I wanted to just share one other thing that I saw in a grocery store, and that is at the Vons up in Ojai, the cashiers are all jammed pretty close together to the customers. It's not a lot of room. It's very narrow. And they actually put up plexiglass shields between their cashier and the customers. So the food passes underneath, but it's a screen up at the face level, and it certainly, if I was a cashier, I'd feel a whole lot better if every customer that came by, I had something, a barrier. So they weren't wearing masks, but they did put that up. So it was, I think, an intelligent thing, and so I want to get it out there for us to consider suggesting that to other grocery stores potentially to protect their cashiers, because those people are certainly taking a risk dealing with so many customers each day. Thank you.
Thank you for that feedback and comments. Mr. Powers.
Supervisor Bennett, just to let you know, we have reached out and shared that suggestion with Walmart, and we'll share it with the other chains as well. Thank you.
And I appreciate both the working to assist the poor clerks and people who work in the stores, but also to do what we can for the public that is having to go there. So thank you for all efforts towards that end.
And thank you everyone for tuning in. We will be back here on Tuesday at 8:30. So I hope that you're able to watch it. And thank you for everyone for all your hard work. Thank you. Meeting is closed.